خب خیلی خوش اومدین به 15مین برنامه زنده 1776. قراره با هم دیگه جلسه بررسی صلاحیت رابرت کندی جونیور رو بررسی بکنیم. اگه اولین باری که برنامه رو تماشا میکنید، من رضا عامری‌ام، میزبان شما تو این برنامه و سالهاست در مورد آمریکا می نویسم، پادکست درست میکنم. توی این سری برنامه هایی که دارین تماشا میکنید، سعی ما اینه که به مهمترین خبرهای آمریکا بپردازیم و به صورت زنده دنبال کنیم چه اتفاقی داره میفته. از قبل از انتخابات 2024 برنامه ها رو شروع کردیم و شب انتخاباتی برای مفصل داشتیم. حالا هم میخوایم بپردازیم به گزینه های ترامپ برای کابینه خودش که امروز 29 ژانویه یکی از مهمترین جلسات رو داریم، جلسه بررسی صلاحیت رابرت کندی که میتونیم بگیم احتمالاً یکی از مهمترین گزینه های ترامپ و شاید یکی از چالشی ترین ها برای تایید شدن توی سنا باشه که در موردش با هم دیگه صحبت میکنیم. و خوش آمد میگم به دوستای عزیزی که توی چتمون حضور دارن و دارن برنامه رو زنده تماشا میکنن. صدا و تصویر من اگر اوکی، مشکلی نداره، ادامه بدیم برنامه رو. اگر هم تغییری نیازه بگین که ببینیم میتونیم بهترش کنیم. جلسه جلسه که الان قرار با هم تماشا بکنیم جلسه کمیته مالی سنای آمریکاست که تقریبا فکر میکنم یه 10 دقیقه یه ربع دیگه باید شروع بشه بر اساس چیزی که اعلام کردن. و من یکم توضیح میدم در مورد اینکه رابرت کندی داستانش چیه و چرا اهمیت داره، موافقانش چی میگن، مخالفانش چی میگن، تا آماده بشیم برای جلسه سنا. فقط من قبلش اجازه بدین یه چیزی رو ست بکنم، تنظیم بکنم. این روزا خبرهای خیلی مهمی از آمریکا داره میاد. انتظار داشتیم که ترامپ یک شروع خیلی خوب داشته باشه، ولی تا یه حدی خود منم واقعا شوکه شدم. در این حد منظم بودن و محکم شروع کردن خیلی جالبه، خیلی اتفاقی داره میفته، خیلی جالبه. حالا در مورد خبرهای مهم این روزام صحبت میکنیم. فقط یه تغییر توی تنظیمات تصویر میدم، شاید یه مقدار تصویر اون بهتر بشه، امیدوارم بدتر نشه. امیدوارم که کیفیت تصویرم بهتر شده باشه. خب بریم سراغ داستان کندی. من فقط یه چک کنم ببینم جلسه اون طرف اگه شروع شده. بریم جلسه رو ببینیم. ظاهرا شروع نشده. آره. خب داستان کندی چیه؟ یکم برای اونایی که نمیدونن یه بیوگرافی بگم از کارهایی که انجام داده و زندگی که سپری کرده تا الان. رابرت اف کندی جونیور متولد واشنگتن دی سی، 71 سالشه. پدرش رابرت اف کندی دادستان آمریکا بود، عموش جان اف کندی رئیس جمهور آمریکا بود، هم پدرش و هم عموش ترور شدن. عضو خانواده کندیه که یکی از مهمترین خانواده های سیاست آمریکاست. در ماساچوست سالها اینا قدرت داشتن، سناتور بودن، فرماندار بودن، نقشای مهم داشتن و به همین واسطه رابرت کندی هم وارد سیاست میشه، حقوق میخونه، توی دانشگاه هاروارد درس خونده، دانشگاه ویرجینیا رشته حقوق خونده، بعد رفته یه تخصصی گرفته توی حوزه environment یا محیط زیست. علاقش ترکیب این دوتا بوده، به نوعی ترکیب حقوق و محیط زیست، فعال محیط زیست بوده. یکی از مهمترین کارهایی که انجام میده بحث محافظت از رودخونه هاتسن نیویورک که یه رودخونه خیلی مهمیه اونجا، به خاطر بحثای مختلف صنعتی آلوده میشه و شروع میکنه کندی یک جنبشی شکل میده برای اینکه محافظت بکنیم از این رودخونه. بیشتر زندگی خودش رو تو این حوزه سپری میکنه و توی چند سال اخیر هم به بحث سلامت خیلی علاقه‌مند میشه. این مؤسسه را میندازه تو بحث سلامت کودکان کار میکنه و این مسیریه که طی کرده، بیشتر بحث محیط زیست و بحث سلامت دغدغش بوده. اتفاق مهم در مورد کندی اینه که سال 2023 به عنوان کاندیدای حزب دموکرات خودشو معرفی میکنه برای انتخابات ریاست جمهوری 2024. سعی میکنه جو بایدن رو به چالش بکشه. دموکرات ها حاضر نمیشن اسم کندی رو روی برگه رأی انتخابات مقدماتی بیارن و خیلی جا دادگاه میرن، داستانهای حقوقی مفصلی اونجا شکل میگیره. در نهایت کندی تصمیم میگیره از حزب دموکرات خارج بشه، اعلام میکنه به شکل مستقل من تو انتخابات شرکت میکنم و جمع‌بندیش اینه که به صورت مستقل هم نمیتونم به جایی برسم. آگوست 2024 توی تصمیم خیلی مهم کندی اعلام میکنه که من از دونالد ترامپ حمایت میکنم، از کمپین انتخاباتی ترامپ حمایت کرد و از همون اول هم ایده کندی این بود که من میتونم یک نگرش جدید به جنبش مگا اضافه بکنم، یه جنبش امریکا فرست اضافه بکنم و اون نگرش بحث مها بود، Make America Healthy Again، اینکه سلامتی رو دوباره تبدیل کنیم به یک مسئله برای آمریکایی ها. کندی سالهاست در مورد این داره صحبت میکنه که به واسطه اتفاقهایی که تو بحث صنعت غذا افتاده بیماری‌های مزمن توی آمریکا زیاد شده، به خصوص توی کودکان بیماری خیلی بیشتر شده و دغدغه‌اش اینه که بتونیم صنعت غذا رو تغییر بدیم به جای اینکه مدام دارو و واکسن تولید بکنیم. دغدغه‌اش اینه که مواد شیمیایی باید از غذای آمریکایی‌ها حذف بشه یا کمتر بشه. تو بحث واکسن دغدغه کندی برخلاف اینکه خیلی‌ها میگن کلاً با واکسن مخالفه، بارها به صراحت گفته من با واکسن مخالف نیستم، صرفاً نگرشم اینه که باید هر فردی خودش تصمیم بگیره آیا میخواد واکسن بزنه یا نمیخواد و خیلی شفاف بهش اطلاعات بدیم بدون واکسن که داره به بدنش وارد میشه چه ویژگی هایی داره. اینا مهمترین دغدغه های کندیه تو بحث سلامت، بحث واکسن، بحث غذای آمریکایی ها، بحث شفافیت بیشتر توی NIH و سازمان های مهم سلامت آمریکا، بحثایی که کندی میخواد توی وزارت سلامت آمریکا اعمال بکنه و خب طبیعیه که خیلی ها موافق نیستن دیگه، به خصوص شرکت های بزرگ دارویی. شاید براشون خیلی خبر خوبی نباشه که یک نفر بخواد به چالش بکشه رویه های صنعت دارو رو. این مهمترین بحثاست در مورد کندی. حالا شما مگه نکته به نظرتون میاد توی چت بنویسید در مورد کندی چی فکر میکنید و اینکه فکر میکنید تایید میشه یا نه. به نظرم میاد یکی از چالشی ترین کاندیداها خواهد بود. بعضی جمهوری خواهان خیلی سیگنال مثبت ندادن به کندی، خیلی موافق نیستن باهاش. دموکرات‌ها که به دلایل مختلفی از اول باهاش موافق نبودن از زمانی که میخواست کاندیدا بشه و مسیر سختی در پیش داره کندی که باید ببینیم به کجا میرسه. خب ظاهرا جلسه سنا داره شروع میشه. بریم برای جلسه کمیته مالی. خب ظاهرا شروع نشده جلسه همچنان. در مورد کندی نکته من باید اضافه کنم، بعضی از جمهوری خواهان دغدغه بحث سقط جنین رو دارن، با توجه به اینکه کندی نگرشش پرو چویس، حامی انتخابه و برای بعضی این سوال وجود داره، برای بعضی از جمهوری خواهان این سوال وجود داره که به عنوان وزیر سلامت چه تغییرایی اعمال میکنه توی بحث سقط جنین یا دسترسی به لوازم و داروهایی که به سقط جنین ارتباط داره. این برای جمهوری خواهی مسئله است که تغییر نکنه خیلی سیاست وزارت سلامت آمریکا. توی سمت دموکرات مهمترین مسئله فکر میکنم به طور کلی مهمترین مسئله اینه که کندی اوتسایدر محسوب میشه، یعنی آدمی نیست که توی این سازمان‌های سلامت بوده، توی این بوروکراسی بوده، برای همین خیلی نمیخوان یه آدم اوتسایدر بیاد بخواد اونجا تحول اساسی ایجاد بکنه. برای بعضی از جمهوری خواهان این مسئله وجود داره. من فکر میکنم به خاطر اتفاقی که در مورد کووید افتاد، آنتونی فاوچی و آدم‌های اطرافش که خیلی پنهانکاری کردن، در مورد شروع کووید پنهانکاری کردن، در مورد راه‌های کنترلش، واکسنش، خیلی موضوعات پنهانکاری شد و هنوز هم ما نمیدونیم واقعا چه اتفاقی افتاده بعد از چند سال. در نتیجه یک حسی توی آمریکا ایجاد شده که باید شفافیت وجود داشته باشه، باید بدونیم توی وزارت سلامت داره چه اتفاقی میفته. بیش از 10 تا سازمان بزرگ زیر مجموعه این وزارت خونن تو بحث داریم. امیدوارم که الان صدا و تصویر من داشته باشین. آره فکر کنم تنظیمات جدید خیلی تنظیمات موفقیت آمیزی نبود و آره چند لحظه قطع شدیم. من همچنان منتظرم که ببینم جلسه کیرینگ. خب ظاهرا جلسه شروع شده، بذارید یه چکی بکنیم.
Good morning.
خب جلسه
This
شروع.
hearing will come to order. This hearing will come to order. I thank my colleagues and Mr. Kennedy for being here today. Mr. Kennedy, congratulations on your nomination. Throughout this process, Mr. Kennedy, you have been accessible to members and staff on both sides of the aisle and have demonstrated strong commitment to fulfilling the responsibilities of this role. The Department of Health and Human Services oversees our nation's largest healthcare programs,
خب کریپور رئیس
providing
کمیته
coverage for
مقدمه
nearly 2 in
میگه
every 5 Americans. Improving Medicare, Medicaid, and CHIP, among other initiatives, presents challenges, especially in the face of a rapidly aging
بچه‌ها
population,
صدای
stubbornly high costs, and
سنا رو داریم
persistent
شما، صدای
barriers
جلسه الان
to
میاد خوبه.
access. However, this also provides us an opportunity to deliver bold, transformative solutions. As a committee, we share a commitment to advancing common sense, bipartisan policies that improve the delivery of health care in this country. This committee has worked to realign incentives in the prescription drug supply chain, to enhance access in rural communities, to expand the availability of telehealth and improve the broken clinician payment structure. Across these and other issues, I look forward to working with the administration to continue pursuing meaningful reforms that serve the American people more effectively and more efficiently. Too often, patients encounter a healthcare system that is disjointed and is a dysfunctional maze. Complex and bureaucratic chutes and ladders have become the norm. Meanwhile, even as healthcare spending climbs, outcomes across a range of conditions continue to decline. Mr. Kennedy, if confirmed, you will have the opportunity to chart a new and better course for the federal approach to tackling both the drivers and the consequences of our ailing healthcare system.
اگه انتخاب بشی
Your
فرصت خیلی
commitment to
مهمی
combating
داری
chronic conditions that drive
تغییر ایجاد
healthcare
بکنی.
costs will be critical to our success. Prioritizing disease prevention and addressing the factors that fuel conditions such as diabetes, cardiovascular disease, metabolic disease, Alzheimer's disease, COPD, and cancer will save
به
lives,
دیابت و
reduce costs,
سرطان و
and build
بیماری‌های
a
قلبی اشاره
healthier,
میکنه که میگه
stronger
تو این
country.
حوزه‌ها میتونیم تغییر ایجاد بکنیم
Private
هم
sector
پیشگیریشون هم
breakthroughs from
درمانشون.
groundbreaking cancer medications to curative gene therapies also offer hope. But misguided government initiatives and market volatility risk eroding American leadership in life-saving R&D. Your advocacy for healthcare transparency has the potential to empower consumers across the country, promoting competition to enhance quality while cutting excessive spending for patients and for taxpayers. Today's hearing will provide a forum to hear more about your vision, particularly for the federal programs under this committee's jurisdiction. Mr. Kennedy, you represent a voice for an inspiring coalition of Americans who are deeply committed to
کسی که داره
improving the
صحبت
health and
میکنه
well-being of our
کریپو
nation.
سناتور آیداهو
Regardless of
رئیس
political party,
چیرمن رئیس
Everyone in this
کمیته
room shares a
فایننس
common recognition that our current system has fallen short,
و
as
داره یه
well as a
مقدمه
common
میگه
desire to make our country healthier.
اینه یکم کم
I look
بکنم.
forward to today's conversation as well as your testimony, Mr. Kennedy.
آره من یکم صداشو
And
کم
I
کنم
recognize
امیدوارم
Senator
صدای من
Wyden
خوب
for his
باشه.
opening remarks.
Thank you very much, Mr. Chairman.
روال معمولا به این صورته که
For the Finance Committee this
رئیس
morning,
کمیته هر کمیته سنا که میدونین سنا کمیته‌های مختلف داره رئیس کمیته یه مقدمه میگه توضیح میده در مورد کاندیدا
committee staff have
و بعد
examined
معاونش که الان وایدن سناتور دموکرات توضیح میده
podcast transcripts
یه مقدمه میگه و بعد کندی یک اینتروداکشن یه معرفی از خودش انجام میده و بعد سناتورها به ترتیب سوال میپرسن. حزبی که اکثریت رو توی سنا داره رئیس همه کمیته رو انتخاب میکنه، حزبی که توی اقلیت معاون کمیته رو انتخاب میکنه. معاون از حزب دموکرات الان وایدن که داره صحبت میکنه و بعد هم بحث سوالا شروع میشه. من سعی میکنم هر چند لحظه توضیح بدم که در مورد چی صحبت میکنم. به صورت همزمان خیلی سخته بخوام همه رو توضیح بدم، همه توضیحاتشون رو، ولی چکیده داستان میگم. آره سعی میکنم توضیح بدم هر فردی که داره صحبت میکنه سناتور دموکرات جمهوری خواه و از کدوم ایالت.
Now, Mr. Kennedy is fond of saying he's not making recommendations about whether parents should vaccinate their children. He's just asking questions.
میگه کندی گفته که من سوال میپرسم، فقط نمیگم با آدم‌ها که واکسن بزنن یا نزنن. وایدن میگه این تکنیکیه برای اینکه کندی فرار کنه از مسئولیت صحبتاش. میخواد شغلی بگیره که همش در مورد توصیه کردنه، توصیه در مورد سلامت، ولی حاضر نیست توصیه بکنه.
Mr. Kennedy, if you are confirmed, your recommendations determine which vaccines senior citizens get for free through
اگه تایید
Medicare.
بشی پیشنهادهای تو تعیین میکنه که آدم‌ها چه واکسنی بزنن.
Which vaccines are given to millions of kids. Peddling these anti-vaccine conspiracy theories as our chief health officer is going to endanger the lives of kids.
همونطور که انتظار داشتیم میره سراغ این که تو مخالف واکسنی به طور کامل.
At what happened when Mr. Kennedy inserted himself into an anti-vaccination crisis in the island nation of Samoa. He traveled there himself to push his views and pour fuel on the fire of a measles outbreak that began due to low vaccination rates. In the end, 83 Samoans died, mostly kids, from a disease that is easily
یه نفر توی
preventable.
چت پرسه به نظرت با توجه به اینکه کندی قبلا دموکرات بوده قراره بهش آسون بگیرن؟ نه، خیلی مشخصه که اینطور نیست. از همین مقدمه داریم میبینین که با اتهامات مختلف شروع میکنن و این در نظر داشته باشین که ما تو دوره‌ای هستیم که نگرش‌های سیاسی خیلی تغییر کرده و اون تعریفی که از دموکرات و جمهوری‌خواه داشتیم عوض شده. الان بیشتر دوره استابلیشمنت و انتای استابلیشمنت. کندی میخواد سیستم درمان آمریکا رو تغییر بده، شفافیت ایجاد کنه. برای همین خیلی از سناتورهای استابلیشمنت چه دموکرات چه جمهوری‌خواه باش موافق نیستن.
Infectious disease research for 8 years. Mr. Kennedy has indicated he's open to restricting access to the abortion medication mifepristone, which remains a primary target.
کندی گفته حاضره یه سری از داروهای سخت جانی رو محدود بکنه دسترسی بهشون.
Back in 1990 when I chaired the first congressional hearing on the topic. The science was clear then, it's even clearer today. Mifepristone is safe. The only reason it's under question in 2025 is because people with a political agenda have been out lying
داره در
about
مورد
it.
داروی سخت جانی
Women
صحبت
deserve
میکنه
to
که
know
علم
Mr.
ثابت
Kennedy will
کرده که
abuse his
درسته
power as our
کار
country's chief
میکنه.
health officer to essentially implement a national abortion ban by restricting access to the safe and legal medication.
به این اشاره میکنه که جمهوری‌خواه
Meanwhile, as the
میخوان
Trump
سخت
budget
جانی رو به
office threw
صورت
the
ملی
Medicaid
ممنوع
program
بکنن.
into chaos yesterday, Republicans in Congress are proposing deep cuts to the program that will rip away health care from millions of Americans who count on this vital lifeline.
و جمهوری‌خواه رو
Cuts to
متهم
Medicaid
میکنه
of
به
this
این که
magnitude
میخوان
are going to jack up the
بیمه
cost of health
درمانی آمریکایی‌ها رو
insurance.
قطع بکنه.
It'll shutter nursing homes and rural hospitals, deprive seniors and
فکر
Americans
می‌کنم
with disabilities of home-based care. That approach
یکی از
amounts to
دوستان سوال کرده
handing
کندی
over
موافق
our
سخت جنینه. من فکر میکنم
to
کندی
for-profit
نگرشش
insurance
موافق
companies
سخت جنینه.
who've made a fortune
آخرین
delaying
چیزی
and
که
denying
خاطرم اینه
care.
که پرو چویس
Mr.
باید
Kennedy has
باشه.
virtually no knowledge or experience in handling these issues. It leaves him unprepared to take on a crisis like the nation witnessed yesterday when the Trump budget office shut down the federal Medicaid payment portal. After a careful review
به این اشاره
of
میکنه
Robert
که
F.
OMB
Kennedy
اومده بودجه یه
Jr.'s
سری
statements,
سازمان‌های فدرال و یه سری
actions, and
کمک‌های فدرال رو قطع
materials that
کرده.
I have reviewed personally and closely, I've reached the conclusion that he should not be entrusted with the health and well-being of the American people. When he's taken every side of every issue, how can this committee and the American people believe he has anything to say? Let me close by saying I believe more strongly than ever, and I have specialized in healthcare during my time in public service, that we're at a turning point with regard to healthcare in America. If there's one word to describe Americans' feelings towards the healthcare system, it's disillusioned. At every single turn, people feel like they're rolling a load of dice, loaded dice, when they try to get healthcare. Americans are justifiably angry, fed up, and tired of a system that puts profits over patients. Instead of debating meaningful ways to improve Americans' healthcare, now the committee is being forced to relitigate
سخت جنین تا 15 هفته منطقیه و بعد از 15 هفته بهتره که یک ممنوعیت سخت جنین وجود داشته باشه. نگرش کندی نگرش احتمالاً جمهوری‌خواهای مثلا دموکرات‌های دهه 60 نگرشیه که الان جمهوری‌خواها دارن در مورد این موضوع و فکر می‌کنم بیشتر جمهوری‌خواها موافقن که تا 15 هفته سخت جنین مسئله نداره بعدش باید ممنوع بشه. نگرش کندی هم ظاهرا همین چیزه. یه بار تو سال 2023 گفته 15 هفته. چیزی که هم باش موافقم.
Thank you, Ranking Member Wyden. Mr. Kennedy, in a few moments you will be given the
صحبت‌های
opportunity to
وایدن
make your
سناتور
opening statement
اورگان هم
and
انجام
respond to
میشه.
these attacks and other questions that the members of this committee have. I would say that with regard to the attack on Medicaid that we just heard, that was a false attack. It's been proven false overnight. The Medicaid portal is operating
میگه در مورد
efficiently
بحث
today.
مدیکیر یا
بیمه
بیمه درمانی ادعای بایدن ادعای دروغه. قرار نیست قطع بشه بیمه درمان تو کل اتفاقی که افتاده اینه که پورتال بیمه درمان تو آمریکا چند ساعت قطع شده و دموکرات‌ها اینو تبدیل کردن به اینکه جمهوری‌خواها میخوان بیمه درمان تو آمریکا قطع بکنن.
Mr. Kennedy, before I turn the time over to you to share your opening statement, I would like to give you a brief introduction. The son of Senator Robert F. Kennedy and nephew of President John F. Kennedy, Robert Kennedy Jr. has been an advocate for consumers since 1985. After graduating from Harvard University, Mr. Kennedy studied at the London School of Economics and received his law degree from the University of Virginia Law School and a master's degree in environmental law from Pace University. He has founded two advocacy groups and has spent the last 40 years working to restore and protect children's health. He was a former independent candidate in the 2024 presidential election, and President Trump nominated him this year to be in November of 2024 to be the HHS secretary.
خب
In announcing his nomination,
یکی از دوستان سوال کرده در مورد استابلیشمنت و آنتی استابلیشمنت توضیح میدی؟ آره درمونش میتونیم مفصل صحبت کنیم. ویدیویی توی کانال فکر نمی‌کنم داشته باشیم الان که دقیقاً به این پرداخته باشه. باید چک کنم.
And make America great and healthy again. Before you give your opening statement, Mr. Kennedy, I have 4 obligatory questions that we ask all nominees before this committee.
سایت
First, is there anything
کمیته
that you are
مالی
aware
سنا
of in
تماشا
your
می‌کنم.
background that might present a conflict of interest with the duties of the office to which you have been nominated?
All right. No, Mr. Chairman.
خب اگه سوال میکنه
Do
آیا
you know of
تضاد
any
منافعی
reason,
داری؟
personal or otherwise, that would in
میگه
any
نه.
way prevent you from fully and honorably discharging the responsibilities of the office to which you have been
یه
nominated?
دلیل
No, I
دیگه
do
وجود
not.
داره که نتونی مسئولیتات انجام
Do you
بدی که این
agree
جواب
without
نه.
reservation to respond to any reasonable summons to appear and testify before any duly constituted committee of Congress if you are confirmed?
Yes, I do.
میگه
And
میای
finally, do
توی
you
کنگره
commit to
شهادت بدی
providing
اگه
a
ازت
prompt
بخوایم
response
توضیح
in
بدی
writing
آره
to any
میام.
questions addressed to you by any senator of this committee?
Yes, I do.
Thank you, Mr. Kennedy. And before you begin, if you would like to, you may introduce your wife and children.
Yes.
خب میگه همسرت و بچه‌هات هم
Hines is
معرفی
here.
کن که همراهت هستن.
My daughter, Kit Kennedy, my son, Bobby Kennedy,
پشت سرش همسرش و
his
بچه‌هاش رو می‌بینی
wife,
که داره معرفی
Amaryllis
می‌کنه.
Fox Kennedy, and my nephew, Jackson Hines, is here too.
We welcome you all. Thank you. You may proceed with your statement.
Thank you, Mr. Chairman. Chairman Crapo, Ranking Member Wyden, and members of this distinguished committee. I'm humbled to be sitting here today as President Trump's nominee to oversee the U.S. Department of Health and Human Services. I want to thank President Trump for entrusting me to deliver on his promise to make America healthy again.
از ترامپ تشکر میکنم
I
که من
also want to
فرصت داد
thank
وعده
Cheryl and Kik and Bobby and all
مها
my
رو
other children
اجرایی بکنم. Make
who
America
are here
Healthy Again.
today, and all the many members of my large extended family for the love that they have so generously shared. Ours has
خانواده‌اش
always
تشکر
been a
می‌کنم.
family that has been involved in public service, and I look forward to continuing that tradition. My journey into the issue of health began with my career as an environmental attorney, working with hunters and fishermen and mothers in the small town in the Hudson Valley and along the Hudson River. I learned very early on that
اشاره میکنه که
human
با بحث
health
هادسون ریور من شروع کردم کارم با حوزه سلامت.
injuries are intertwined. The same chemicals that kill fish make people sick.
یه هم مواد شیمیایی که ماهی‌ها رو مریض
Today,
میکنه انسان‌ها
Americans'
رو هم
overall
بیمار
health
میکنه.
is in grievous condition. Over 70% of adults and a third of children are overweight or obese.
70% آدمای بالغ تو
Diabetes
آمریکا
is 10 times
اضافه
more
وزن دارن.
prevalent than it was during the 1960s. Cancer among young people is rising by 1 or 2% a year. Autoimmune
سرطان داره
diseases,
1-2% هر سال
neurodevelopmental
بیشتر میشه
disorders,
بین جوانان.
Alzheimer's, asthma, ADHD, depression, addiction, and a host of other physical and mental
همه
health
بیماری‌ها داره اشاره
conditions
میکنه.
are all on the rise.
دیگه
some of
همشون
them
داره تو آمریکا
exponentially.
بیشتر و بیشتر میشه.
The United
دیابت و
States
چیزای
has
مختلف.
worse health than any other developed nation. Yet we spend more on healthcare, at least double, and in some cases triple, as other countries.
که بیشتر از کشورهای دیگه داریم تو
Last year we
حوزه
spent
سلامت
4.8
هزینه میکنیم.
trillion, not counting the indirect costs of missed work. That's almost a fifth of GDP. It's tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with countries that pay a third of what we do for health and have better outcomes and a healthier workforce.
کشورهای اصلا 1/3
But I don't
ما
want to
هزینه
make
میکنن
this too much
سلامت
about
بهتری
mine.
دارن.
It's the human tragedy that moves us to care. President Trump has promised to restore America's global strength and to restore the American dream, but he understands we can't be a strong nation when our people are so sick.
یه رویای آمریکایی بدون
A
سالم
healthy
بودن
person
به جایی
has
نمیرسه.
1,000 dreams. A sick person has only one. Today, over half of our countrymen and women are chronically ill. When I met with President Trump last summer, I discovered that he has more than just concern for this tragic situation, but genuine care. President Trump is committed to restoring the American dream, and 77 million Americans delivered a mandate to him to do just that.
ترامپ میخواد
Due in part to the
سلامتی
embrace and
ایجاد کنه. 70 خورده
elevation
میلیون بهش
of
رأی
the Make
دادن.
America Healthy Again movement. This movement, led largely by Maha moms from every state, you can see many of them behind us today, and in the hallways and in the lobbies, is one of the most transcendent and powerful movements
حامیای
I've ever
جنبش
seen.
ماهام پشت سرش
I promise
نشستن.
President Trump that if confirmed, I will do everything in my power to put the health of Americans back on track. And I've been greatly heartened to discover a deep level of care among members of this committee, too, both Democrats and Republicans. I came away from our conversations confident that we can put aside our divisions for the sake of a healthier America.
میتونیم اختلافامون رو کنار
For a long
بذاریم
time,
برای
the
آمریکای
nation
سالم‌تر.
has been locked in
خطاب به
a
دموکرات‌ها و
divisive
جمهورخواها.
healthcare debate about who pays. Well, when healthcare costs reach 20%, there are no good options, only bad ones. Shifting the burden around between government and corporations and insurers and providers and
کندی 71
families is
سالشه.
like rearranging deck chairs on the Titanic. Our country will sink beneath a sea of desperation and debt if we don't change the course and ask why are healthcare costs so high in the first place. The obvious answer is chronic disease.
میگه چرا اینقدر هزینه درمان تو آمریکا
90% of
زیاده؟
healthcare
خاطر
spending
بیماری‌های
goes toward
مزمنی که وجود
managing
داره.
chronic disease, which hits lower income Americans the hardest. The president's pledge is not to make some Americans healthy again, but to make all of our people healthy again. There is no single culprit in chronic disease. Much as I have criticized certain industries and agencies, President Trump and I understand that most of their scientists and experts genuinely care about American health. Therefore, we will bring together all stakeholders in pursuit of this unifying goal.
سعی می‌کنیم اتحاد ایجاد
Before I
کنیم توی
conclude, I
جامعه
want to make
علمی.
sure the committee is clear about a few things. News reports have claimed that I am anti-vaccine or anti-industry. I am neither. I am pro-safety.
خب ظاهرا یه نفر صحبتاشو قطع میکنه و معترض به کندی. داشت میگفت من ضد واکسن
Please
نیستم
proceed, Mr. Kennedy.
که همون
I
لحظه
am
داد و فریاد
pro-safety.
شنید.
I worked for years to raise awareness about the mercury and toxic chemicals in fish, and nobody called me anti-fish. And I believe that
میگه سالها در مورد آلودگی ماهی‌ها صحبت کردم، کسی نگفت من ضد ماهی‌ام. الانم میخوام واکسن بهتر بشه.
I've written many books on vaccines. My first book in 2014, the first line of it is I am not anti-vaccine.
من
And
ضد
the last
واکسن
line
نیستم
is
به
I
طور
am not
کامل.
anti-vaccine. Nor am I the enemy of food producers. American farms are the bedrock of our
میگم
culture,
مخالف
of our
تولید کننده‌های
politics,
غذا
of our
هم نیستم
national
توی آمریکا.
security. I was a 4-H kid, and I spent my summer working on ranches. I went to work with our farmers. I want to work with our farmers and food producers to remove burdensome regulations and unleash American ingenuity.
میخوام کار کنم با کشاورزای
Simply
آمریکایی،
cannot
تولید کننده‌های
succeed
غذا.
without a partnership, a full partnership of American farmers. In my advocacy, I've often disturbed the status quo by asking uncomfortable questions.
میگه من همیشه
Well,
وضع
I'm not
موجود رو به
gonna
چالش
apologize for
میکشم،
that.
سوالای
We have
ناراحت کننده
massive
گاهی
health
میپرسم.
problems in this country that we must face honestly. And the first thing I've done every morning for the past 20 years is to get on my knees and pray to God that he would put me in a position to end the chronic disease epidemic and to help
میگه تو 20 سال
America's
گذشته
children.
هر روز صبح دعا میکردم
That's
خدا
why
من
I'm
توی
so
موقعیتی
grateful
بذاری که بتونم با
President
بیماری‌های
Trump
مزمن تو آمریکا
the
بجنگم.
opportunity to sit before you today and seek your support and partnership in this endeavor. I will conclude with a promise. The members of this committee, to the president, and to all the tens of millions of parents across America, especially the moms, who have propelled this issue to center stage. Should I be so privileged as to be confirmed, we will make sure our tax dollars support healthy foods. We will scrutinize the chemical additives in our food supply.
مواد شیمیایی تو غذا رو بررسی می‌کنیم.
Conflicts of interest from our agencies.
تضاد
We will
منافع تو
create
سازمان‌های
honest,
فدرال رو بررسی
unbiased,
می‌کنیم.
gold standard science at HHS, accountable to the president, to Congress, and to the American people.
از
We will
علم
reverse the
استفاده
chronic
می‌کنیم و به
disease
رئیس جمهور
epidemic
پاسخگو خواهیم
and
بود.
put the nation back on the road to good health. Thank you.
خب صحبتاش تموم میشه.
Thank you, Mr. Kennedy.
بریم
Mr.
سراغ
Kennedy, I will
سوالات.
begin. Each of us will have 5 minutes to ask you questions, and then at the conclusion of the hearing, if there are further questions, there will be an opportunity for those questions to be submitted to you, and I ask that you respond
هر
to them
سناتور 5
promptly.
دقیقه فرصت داره سوال کنه. کریپو خودش
Mr.
شروع
Kennedy, you
میکنه.
have
سناتور
emphasized
آیداهو.
the importance of nutrition in preventing and managing chronic disease,
یه بحث
improving
مواد
health outcomes,
مغذی
and
اشاره
reducing
کردی.
health costs. I share your interest in the relationship between our diet and our well-being.
سلام،
And
خوش
if
اومدین.
confirmed, I look forward to partnering with you on those efforts. Would you share with the committee why you are passionate about the nutrition-oriented disease prevention and
یه
what
چرا
you
اینقدر در
have
مورد
learned?
مواد مغذی
Yes, Mr.
هیجان
Chairman.
داری،
I had
پشنیتی؟
11 brothers and sisters. I had dozens of first cousins. I was raised in a time where we did not have a chronic disease epidemic.
11 تا
My
برادر
uncle was
داشتم.
president, 2%
توی
of
دوره
American
بزرگ شدم که
kids have
خبری از
chronic
بیماری‌های
disease.
مزمن نبود.
Today, 66% have chronic disease. We spend zero on chronic disease during the Kennedy administration. Today, we spend $4.3 trillion a year. With
66% آمریکایی بیماری مزمن دارن. 2 تریلیون داریم هزینه می‌کنیم هر سال.
When I was a kid, the typical pediatrician would see one case of diabetes in his or her lifetime, 40 or 50-year career. Today, 1 out of every 3 kids who walks through her office door is diabetic or pre-diabetic. And the most recent data from NIH shows 38% of teens are diabetic or pre-diabetic.
38% نوجوانای آمریکایی یا دیابت دارن یا مستعد دیابت هم.
Depending on what studies you look at. In my generation today, 70-year-old men, 1 in 34 in my kids' generation. We've seen this explosion of autoimmune disease, of allergic diseases.
یه بیماری‌های خود ایمنی و آلرژی خیلی زیاد شده تو آمریکا.
Economic issue. It's not just a national security issue. It is a spiritual issue and it is a moral issue. We cannot
هم مسئله
live up
اخلاقی، هم
to our
اقتصادی، هم
role as an
معنوی.
exemplary nation, as a moral authority around the world, and we're writing off an entire generation of kids.
Thank you very much. And if confirmed, how could we work together to integrate nutrition-based interventions into our healthcare programs like Medicaid and Medicare?
چطور میتونیم مواد مغذی بیاریم توی
there are
سیستم
many ways that we
بیمه
can do
درمان
that.
آمریکا؟
A federal funding of the SNAP program, for example, and of school lunch programs could be a driver for helping kids. We shouldn't be giving 60% of the kids in school processed food that is making them sick.
میگه میتونیم کمک‌های مالی فدرال رو به جای اینکه صرف غذای پروسس شده پردازش شده بکنیم، برآوری شده بکنیم، صرف غذایی بکنیم که مواد مغذی داره.
We also, in Medicaid and Medicare, we need to focus more on outcome-based medicine, on putting people in charge of their own health care, of making them accountable for their own health care so they understand the relationship between eating and getting sick.
هر فردی خودش مسئول سلامت خودش باشه، ارتباط غذا و سلامتی بهتر درک کنه.
Research to understand the relationship between these different food additives and chronic disease so that Americans understand it and make sure that Americans are aware. But I don't want to take food away from anybody. If you like a cheeseburger, a McDonald's cheeseburger, a Diet Coke, which my boss loves, and you should be able to get them.
میگه نمیخوام غذای کسی رو بگیرم. اگه مثل ترامپ چیزبرگر رو کوکاکولا دوست دارین میتونین بخورین. من نمیخوام از کسی مجبور کنم رژیم خاصی داشته باشه.
Senator Wyden.
نکته خیلی خوبی اشاره
Before I
کرد.
begin my
رژیم
questions, I'd
غذایی
like to
ترامپ واقعا
start by
جالب.
entering into the record a letter the committee received from
خب میریم
Ambassador
سراغ
Carolyn
وایدن،
Kennedy
سناتور دموکرات
outlining what she
اورگان.
believes is Mr. Kennedy's lack of personal fitness for the office.
Without objection.
Mr. Kennedy, you have spent years pushing conflicting stories about vaccines.
خب میگه در مورد واکسن تو ادعاهای مختلفی مطرح کردی.
In your testimony today under
هر جا
oath,
یه
you
چیزی
denied that
گفتی.
you were anti-vaccine. But during a podcast interview in July of 2023, you said, quote, "No vaccine is safe and effective."
میگه توی
In your
پادکست گفتی هیچ
testimony
واکسنی
today, in
سیف
order to
امن
prove
نیست.
you're not anti-vax, you note that all your kids are vaccinated. But in a podcast in 2020, you said, and I quote, "You would do anything, pay anything to go back in time and not vaccinate your kids."
میگه همه بچه‌هات واکسن زدم ولی توی پادکست گفتی حاضرم هر کاری کنم برگردم عقب بچه‌هام واکسن نزنن.
Cannot be true. So, are you lying to Congress today when you say you are pro-vaccine? Or did you lie on all those podcasts?
میگه تو پادکست دروغ گفتی الان دروغ میگی. حامی واکسنی مخالف
Senator,
واکسن.
as you know, because it's been repeatedly debunked, that statement that I made on the Lex Friedman podcast was a fragment of the statement. He asked me, and anybody who actually goes and looks
این
at
بخشی از
that
حرفی که من
podcast
زدم این تیکش کات کرد.
and will see this. He asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective. And I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
یه حرف این بود که هیچ واکسنی برای همه آدم‌ها نمیتونه بدون مشکل باشه.
Many times, including on national TV, you know about this, Senator Wyden. So bringing this up right now is dishonest.
Let's be clear about what you've actually done then, since you want to deny your statements. For example, you have a history of trying to take vaccines away from people. In May of 2021, you petitioned the Food and Drug Administration to not only block Americans from having access to the COVID vaccine, but to prevent any future access to the life-saving vaccine.
میگه توی شکایت کردی از شکایت کردی دولت بایدن.
We brought that petition after CDC recommended the COVID vaccine without any scientific basis for 6-year-old children. Most experts
یه زمانی که دولت بایدن سازمان CDC اعلام کرد بچه‌های 6 ساله باید واکسن کووید بزنن و لازمه، ما اون موقع شکایت کردیم که لازم نیست برای بچه‌های 6 ساله که واکسن بزنن.
That's why I brought that lawsuit I don't want to. I want to emphasize
Mr. Kennedy, the
I don't.
facts.
خب دوباره میبینیم یه نفر
The committee will be in order.
جلسه رو قطع میکنه.
And to the audience,
Senator, I'm
فکر
not.
کنم به
I
کندی
can't
داشت
stand-
میگفت
Hold
وی
on
لاو
for a
یو
second,
دوست
Mr.
داریم.
Kennedy.
فکر کنم
To the
طرفدارای
audience.
کندی هستن.
comments from the audience are inappropriate and out of order. And if there are
خلاصه
any
داستان
further
اینه که
disruptions, the
میخوان رو
committee
بحث
will recess
واکسن
until
تاکید
the
کنن
police
و
can
کندی داشت
restore
توضیح میداد
order.
که من مخالف
Please
واکسن
follow the
نیستم،
rules
صرفا
of the
گفتم که
committee.
بعد واکسن
Mr.
ها
Kennedy, you may proceed.
بررسی بشه و
I
همه
also
واکسن ها
want to
برای
point out
همه
that
آدم ها
your
سیف نیست.
Recitation of what happened in Samoa is absolutely wrong, and you know it's wrong, and you know it's wrong.
We'll get to that in a moment. Right now, we're talking about the petition that you filed to block Americans from having access to the vaccine
از یه
and to
سازمان
prevent
فدرال
any future
شکایت
access to
کرده
the vaccine.
که
Those facts
چرا
are on
میخوایم
the
بچهای
record.
6 ساله
My
رو
third
مجبور کنیم
question
واکسن
to you
بزنن.
is,
حالا وایدن میگه
you
چرا
made almost
شکایت
$5
کرد؟
million from book deals, mostly promoting junk science. In 2021, in a book called The Measles Book, you wrote that parents had been, quote, misled into believing that measles is a deadly disease and that measles vaccines are necessary, safe, and effective.
میگه تو مقدمه این کتاب گفتی یه واکسنی خیلی مناسب نیست و پدر مادرها گول خوردن که باور کردن.
Of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
The death rate from measles historically in this
میزلز
country
چیه؟ من
in
به این مشاوره پزشکی
1963, the
نیاز
year
داریم.
before the introduction of the vaccine, was 1 in 10,000. Let me explain what happened in Samoa. In Samoa, in 2017 or 2015, there were 2 kids who died following the MMR vaccine. And the vaccination rates in Samoa dropped precipitously from about 63% to the mid-30s, so they've never been very high. And in 2018, 2 more kids died following the MMR vaccine, and the government of Samoa banned the MMR vaccine. I arrived a year later when vaccination rates were already below any previous level. I went there, nothing to do with vaccines. I went there to introduce a medical informatics system that would digitalize records in Samoa and make health delivery much more efficient. I never gave any public statement about vaccines. You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. I went in June of 2019. The measles outbreak started in August. Oh, clearly I had
ظاهرا توی
nothing to do with the
ساموآ
measles. Not only that,
بیماری اتفاق میفته که داشتن واکسن میزدن به افراد و کندی رو متهم میکنن که تو نذاشتی خیلی اونجا واکسن بزنن.
There are 83 people died. When the tissue samples were sent to New Zealand, most of those people did not have measles. We don't know what was killing them. The same outbreak occurred in Tonga and Fiji, and no extra people died. There were 7 measles outbreaks in the 13 years prior to my
Chairman, I just
arrival.
would like to get my time back. The nominee wrote
با
a
هر
book
سختی هست کندی داره
saying
سعی
that
میکنه
people
حرفشو
had been
بزنه.
misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move
Senator,
on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
We need to move on. Senator Grassley.
یا مخالف
I'm going to do
سرخک میزلز میگه مخالف واکسن سرخک نیستم.
I got about 7 I want to quickly get done, and then at the end I'm going to ask if you disagree with anything I say, and then address those things you disagree with. I'll make sure I save time for you to do that.
ظاهرا کندی رفته ساموا، اونجا بیماری سرخک اتفاق افتاده، داشتن واکسن میزدن. کندی میخوام بگن کندی نذاشته واکسن بزنن آدم. خب میریم سراغ گرسلی، سناتور جمهوریخواه آیووا. بچه صدا نمیدونم واقعا چطوره، من الان صدای خودم، صدای سنا، اگه چیزی نیاز به تغییر داره بگین تغییرش میدیم.
In order to lower prescription drug prices, I expect you to work with us to hold PBMs accountable, and that may even ask in your support for legislation that's before the Congress. Drug pricing.
گرسلی به قیمت دارو اشاره میکنه و مقررات و قوانین برای اینکه قیمت دارو کاهش پیدا کنه.
Knowing what something costs before buying it is just common sense. President Trump tried to do this by regulation in his first term. Vice President Vance co-sponsored our bill last Congress. I ask you to support this bill, or if you can do it by regulation, to do it by regulation. On rural health care, the previous administration dragged its feet in opening up slots for rural community hospital demonstration programs. It also ignored concerns from rural pharmacies when implementing
داره مصوباتی اشاره میکنه برای بیمارستان‌های مناطق روستایی که میگه ما همچین مصوباتی داریم، تو حمایت میکنی. طبیعتاً کندی هم جواب مثبت میده. معمولا اینطوریه تو جلسات هیرینگ.
On agriculture. In our meeting earlier this month, we talked at length about agriculture.
در مورد کشاورزی صحبت کردیم با هم تو جلسه مشترکمون.
I expect you to leave agricultural practice regulations to the proper agencies, and for the most part, that's USDA and EPA.
میگه در مورد کشاورزی به نظرم بذار وزارت کشاورزی تصمیم بگیره، مقرراتی اعمال نکن تو این حوزه.
Requesting that they provide information regarding conflicts of interest on the dietary guidelines committee to increase transparency. I expect you to provide Congress with confidential financial disclosures from the advisory committee before finalizing dietary guidelines, so we know that nobody has a vested interest in it, is having undue influence. Lastly, HHS, Office of Refugee Resettlement Oversight. Last year, I expanded my investigation into HHS's Office of Refugee Resettlement. I wrote 24 contractors and grantees whose job it is to place unaccompanied children with sponsors. In many cases, children have been placed with improper vetted sponsors, placing them
گرسلی به بحث پناهنده ها اشاره میکنه. بچه هایی که زیر 18 سال بودن با از طریق کارتلا وارد آمریکا شدن و چند صد هزار نفرشون گم شدن و ظاهرا به HHS ربط داره این موضوع، به وزارت سلامت.
I expect you to produce to me the records and data I've requested and instruct HHS contractors to fully cooperate with my investigation. I also expect
به ما اطلاعات بده که چه اتفاقی افتاده در مورد این بچه‌ها. ما در مورد یه بار صحبت کردیم، چند صد هزار تا بچه اومدن تو آمریکا و سازمان‌های فدرال اینا رو واگذار کردن به آدم‌هایی که الان معلوم نیست کیه، دیتا هیچ جا ثبت نکردن. خیلی عجیبه.
I agree with all of those provisions, Senator.
کندی با همه صحبتات موافقم.
My approach to administration HHS will be radical transparency. If members of this committee or other members of Congress want information, the doors are open. I've spent many years litigating against NIH and its sub-agencies. HHS and its sub-agencies, NIH, CDC, FDA, on FOIA issues, trying to get information that we, the taxpayers, pay for.
بارها سعی کردم درخواست بدم از
copies
سازمان‌های
after a year or
فدرال
2 years of
درخواست فویا
litigation.
بدم
That
که
should not be the
اطلاعات به من بدن که
case.
دارن
And
چیکار
if
میکنن.
Congress asks me for information, you
برای
will get
همین
it immediately.
خودم سعی میکنم شفاف عمل بکنم.
Thank you. Senator
در
Cantwell
مورد
is
فویا هم
next.
شاید یه تایمی باید
But
صحبت
until
کنیم.
she
داستانش
returns, I
چیه
will move
فویا
on to
ریکوست رو
down the
آمریکا.
list, and that would be Senator Cornyn.
خب
Mr.
میریم
Kennedy,
سراغ
welcome to you and your family, and
کورنن.
congratulations. I appreciate Senator Grassley
سناتور
raising
جمهوری‌خواه
the
از
issue of
تگزاس.
the Office of Refugee Resettlement within the auspices of Health and Human Services.
من این نکته
I think
توضیح
this
بدم
may
که صدا
surprise
کم کنم.
people.
در
That's
مورد
actually the
مایک پنس
responsibility
چیزی
of
که من
HHS,
شنیدم اینه
the
که
Office of
یه مؤسسه
Resettlement
وابسته به
Relocation.
مایک پنس
Under
هزینه
the
کرده
previous administration,
برای
Senator
کمپین
Grassley alluded there were
تبلیغاتی
roughly
و روابط عمومی
500,000
که بیاد
children, unaccompanied minors that were
کاندیداتوری
placed with
کندی رو به
sponsors
چالش
in the
بکشه. یعنی
interior
مایک
of
پنس
the
سعی
United
کرده هزینه
States.
بکنه که
The previous
کندی رأی
administration
نیاره
took
توی
the
سنا.
position that it
این
was
چیزی که
not the
من
federal
خوندم.
government's responsibility once these children were placed with these sponsors. But the New York Times, in a series of investigative stories, pointed out that tens of thousands of these children, when they tried to follow up and find out how they were doing, whether they were going to school,
کورنن
whether they
هم
were
بس
being
همین بچه‌هایی که گم
trafficked or
شدن اشاره
abused,
میکنه.
there was no answer, and they took the position it was not their
آره
responsibility.
بیش
So
از
I
500
look
هزار.
forward to
آره فکر
working with
میکنم
you
600
to
یه هم چیزی
find
600
those
هزار
children
بچه
and to make sure that
گم
they're
شدن
not
توی
being
آمریکا
abused.
به واسطه سوء
Millions of
مدیریت سازمان‌های
Americans are
فدرال.
experiencing mild to moderate mental health and substance abuse issues, yet many struggle with timely and effective access. Primary care physicians are most likely to be seeing these individuals as opposed to a specialist, and it makes it important that these individuals, primary care physicians, be trained in patient-centered care, which would strengthen the integration of behavioral health care with primary care services. Is this something that you are concerned about, something you'd be willing to work with us on in order to implement?
Yes, Senator, and let me just
من سوال واقعیت
President Trump has
یه لحظه از
personally
دادم
spoken
داشتم
to
چت رو
me
نگاه میکردم.
about locating those
سوالای جمهوری‌خواه
300,000
معمولا خیلی
children that
چالشی
disappeared
نیست.
over the
مثلا
last 4
میگم
years.
اینجایی که هم
I
بیشتر
don't
به
think
چت
anybody has an
بپردازیم و
fully
سوالای
accurate
دموکرات‌ها
number,
رو
but it's
بیشتر.
hundreds of thousands, I agree.
And many of them we know have been sex trafficked and childhood slavery, and it is a blight on America's moral authority, and we need to find those kids. In terms of addiction services,
من این نکته بگم حالا دارن در مورد بحث اعتیاد و مواد مخدر و درمانش صحبت میکنن. اونم این که در مورد عمل تغییر جنسیت ترامپ یک فرمان اجرایی میخواد امضا بکنه که بر اساس این فرمان اجرایی سازمان‌های فدرال دیگه بودجه ندن برای عمل تغییر جنسیت که خیلی بحث مهمیه. کندی هم طبیعتاً به عنوان وزیر سلامت تو این حوزه میتونه نقش مهمی داشته باشه که دیگه بیمارستان‌ها و مراکز درمانی تحت پوشش بودجه فدرال عملهای تغییر جنسیت رو انجام ندن، هم برای کودکان هم برای بزرگسالان. بیشتر سازمان‌ها توی آمریکا، بیشتر سازمان‌های درمانی دارن از بودجه فدرال کمک میگیرن. برای همین این تصمیم ترامپ میتونه خیلی تاثیرگذار باشه روی اینکه عملهای تغییر جنسیت تا حد زیادی کاهش پیدا کنه توی آمریکا.
where there is a moment where they hit periodic bottoms where they're
امیدوارم توضیح
ready to go into treatment. But it's fleeting
مفید
and
بوده
it's
باشه.
momentary. And we have
فقط
the
توی چت سوال
opportunity to
کردن
save their
داستان چیه.
lives. And then if we miss that little short window, they're off to the races again.
I appreciate your answer. Our time is short. Let me get to one more question
کورنن میگه
that
سوال
I think
دیگه
is
هم
very
دارم.
important. Under the first Trump administration, the number of people receiving HIV treatment in Africa through the President's Emergency Plan for AIDS Relief, otherwise known as PEPFAR, it increased, this is during the first Trump administration, from 13 million people to 18 million people across 50 countries, primarily in Africa. Africa has about 1.3 billion people
برای
today, or
درمان
in
HIV
2021,
تو آفریقا
it's projected to have
هزینه داره میکنه و تو
2.5
دوره
billion
ترامپ
people
از
by
13
2050, or
به 18
25%
میلیون
of the
نفر
global
رسیده کمک
population.
های
In 2020,
آمریکا برای
PEPFAR reported
بحث
that
HIV یا ایدز.
2.8 million babies were born without HIV. That was something that would not have happened but for the PEPFAR program.
خیلی نکته جالبیه که یه سری از جمهوری‌خواها همچنان معتقدن که آمریکا باید هزینه کنه برای درمان HIV توی آفریقا.
Failure to continue this program, in my view, would risk ceding that leadership to adversaries like China. And I'd like to know whether you support the objectives and
جالب
goals
کورنین دغدغه‌اش اینه که میگه اگه ما
and
هزینه
would you
نکنیم
work
چین
with
میره
me
هزینه
and my
میکنه برای
colleagues to make
درمان
sure that
HIV
this
توی
program
آفریقا
continues to provide
و نه بذاریم چین
life-saving
کار انجام بده.
antiviral drugs to people who are most in need.
I absolutely support PEPFAR, and I will happily work with you to strengthen the program.
میگه من حمایت میکنم
you.
از این
Senator
برنامه
Bennett.
که ما برای
Thank you,
درمان
Mr.
HIV
Chairman.
تو
Thank you,
آفریقا
Mr.
بیشتر
Kennedy,
هزینه
for
بکنیم.
being here this morning. And I think that, Mr. Chairman, we are truly through the looking glass this morning.
خب
here
بنت
in the
سناتور
US
دموکرات
Senate, and this
کلرادو
committee
نفر
is
بعدی
being
که صحبت
asked
میکنه.
to fulfill a really important responsibility, which is to decide whether to confirm Mr. Kennedy to one of the most important healthcare jobs in America. And the reason I think it's so important is for many of the reasons you said in your opening statement, which is that we live in the richest country in the world, and we have some of the worst health outcomes of any industrialized country.
بنت حرفای کندی رو
We live
تکرار
in the richest
میکنه.
country in the world,
ما
and
ثروتمندترین
we
کشور
have some
دنیا
of the
هستیم ولی
lowest life expectancy rates of anybody
اما
in
بدترین
the
وضعیت
industrialized
سلامت رو
world.
داریم بین
I was a
کشورهای
school
صنعتی،
superintendent
بدترین
before I was
وضعیت
in this
لایف
job,
اکسپکتنسی رو داریم.
Mr. Chairman, and
امید
I
به
can tell
زندگی.
you that Mr. Kennedy's right, you know, that when I look at the kids in the Denver public schools, if we don't change the way we eat in this country, 40% of them are going to suffer adult diabetes as a result
به بحث دیابت
of
کودکان
their
اشاره
diet.
میکنه.
These are and we're, as I said, spending more than any other country in the world, and our families, every single person's constituents in this Senate are facing chronic shortages when it comes to health care. My friend from Texas, Senator Cornyn, has been a champion on mental health care. We have an epidemic, as he knows, across this country in mental health care,
اپیدمی سلامت روان داریم توی آمریکا.
The massive social media platforms that were sitting behind the President of the United States have inflicted on our children for their profit in the last decade
و
or
میگه
so.
مشکل شرکت‌های سوشال میدیا، شبکه‌های اجتماعی هستند که از ترامپ هم حمایت کردن. جالبه تا قبل اینکه از ترامپ حمایت کنن مشکلی نداشتن شبکه‌های اجتماعی.
Mr. Kennedy, what is so disturbing to me is that out of 330 million Americans, we're being asked to put somebody in this job who has spent 50 years of his life not honoring the tradition that he talked about at the beginning of this conversation, but peddling in half-truths.
300 خورده میلیون نفر به عنوان وزیر سلامت که 50 سال زندگیشو صرف زیر سوال بردن سنت هایی که صحبت میکنه، زیر سوال بردن سیستم درمان آمریکا منظورشه.
is unsafe, not that you can't possibly have an adverse reaction, but that parents and children in my old school district and school districts all over this country would be better off not getting vaccinated than getting vaccinated. Unlike his own children who were vaccinated, unlike the people he invited to his house in Los Angeles for their party who were vaccinated. For everybody else, it's about peddling these half-truths. And he says it with such conviction that you want to believe him.
اینقدر مطمئن میگه که میخواد بهش باور کنی.
There are many, many things in the record, but I hope that you could answer these questions yes or no. I've tried to ask these in a manner that's faithful to what you actually said, because I didn't want to have a debate about whether you actually said them. So I'm asking you yes or no, Mr. Kennedy. Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people, but spared Ashkenazi Jews and Chinese people?
What?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say that it targets black and white people, but spared Ashkenazi
I
Jews
quoted
and
a
Chinese?
study.
کووید آدمای سفید پوست و سیاه‌پوست رو هدف قرار داده ولی یهودی اشکنازی رو هدف قرار نداده.
I have to move on. Did you say that Lyme
نمیذاره
disease
جواب بده
is
بنت.
is highly likely a materially engineered bioweapon? I made sure I put in the highly likely. Did you say Lyme disease is a highly likely militarily
نگاه تو گفتی
engineered
بیماری
bioweapon?
لایم
I probably
یه
did say
سلاح
that.
Did you say
بیولوژیکه.
And that's what the developer of
I
Lyme
want all
disease
of our
said.
colleagues to hear it, Mr. Kennedy. I want them to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I
نگاه
have the
گفتی
record that I'll
بچه‌هایی
give
که
to the
در
chairman
معرض
and he can make his judgment about what
سموم
you
شیمیایی
said.
قرار میگیرن
Did
زودتر
you write in
ترنس
your
میشه،
book,
احتمالش
and
بیشتر ترنس
it's
میشه.
undeniable
کندی میگه
that
همچین چیزی نگفتم، من همچین
African
حرفی نزدم.
AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay, I'll give it to the chairman, Mr. Kennedy. And my final question, did you say on a podcast, and I quote, I wouldn't leave it, abortion, to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term. Did you say that, Mr. Kennedy?
Senator, I believe that every abortion is a tragedy.
نگاه تو
you
گفتی
say it,
هر
Mr.
زن باید
Kennedy?
در مورد ساخت جنین تصمیم
This
بگیره.
matters. It doesn't matter what you come here
هر
and
زن باید
say.
در مورد ساخت جنین
It
تصمیم
isn't
بگیره،
true.
حتی اگه
It's not
بچه‌ش
reflective of what you really believe that you haven't said over
کامل
decade
رشد
after
کرده
decade
باشه.
after decade. Because unlike
و
other
فرصت
jobs
نمیده
we're
کندی
confirming
حتی
around this
حرف
place,
بزنه، یه
this is
جمله
a
بگه.
job where it is life and death for the kids that I used to work for in the Denver public schools and for families all over this country that are suffering from living in the richest country of the world that can't deliver basic health care and basic mental health care to them. It's too important for the games that you're playing, Mr. Kennedy. And I hope my colleagues will say to the president, I have no influence over him. I hope my colleagues will say to the president, out of 330 million Americans, we can do better than this.
Thank you. We
5
need to
تا
move
سوال
on.
پرسید، نذاش کندی
Cassidy.
یه جواب درست به هر کدومشون بده. یکم داد کشید و بحث رو جمع کرد.
President Trump has
خب سناتور
sworn to
کسدی،
protect
سناتور
Medicare.
جمهوری خواه،
Republicans are exploring reforms to Medicaid that could help pay for Trump administration priorities. With this context, what will you do about dual eligibles?
About,
Dual eligibles.
well, dual eligibles are not right now served very well under the system. Those are people who are eligible for both Medicaid and Medicare. I suppose my answer to that is to make sure that the programs are consolidated, that they're integrated, and the care is integrated. I look forward to working with you, Dr. Cassidy, on making sure that we take good care of people who are
Thank you.
dual eligible.
And how do you propose that we integrate those programs? Does Medicare pay more, Medicare pay less, Medicaid pay more, Medicaid pay less? How do we do that?
فکر میکنم داره در این صحبت میکنه آدمایی که هم برای مدیکید هم برای مدیکر شرایط دریافتشون رو دارن، باید چطور بهشون خلاص درمان بدیم.
is fully paid for by the federal government, and it's not fee for service. So I do not know the answer to that. I look forward to
دقیقا نمیدونم جوابش چیه و سعی میکنم
Republicans again
باهاتون
are
کار کنم
looking
تا
at
جواب
ways to
برسه.
potentially reform Medicaid to help, pay for President Trump's priorities, but to improve outcomes. What thoughts do you have regarding Medicaid reform?
Well, Medicaid is not working for Americans, and it's specifically not working.
تفاوت مدیکر و مدیکید هم من توضیح بدم. مدیکر بیمه سلامتیه که برای افراد بالای 65 ساله، برای بازنشسته هاست، یا آدم هایی که یک نقص بدنی دارن و یه بخش خود فرد میده، کارفرماش میده. مدیکید اما برنامه‌ایه که برای آدم‌های فقیر و دولت فدرال و دولت ایالتی هزینه پرداخت می‌کنن برای بیمه آدم‌های فقیر.
And the irony of the expansion is that the poorest Americans are now being robbed. Their services have dramatically decreased, even though we've increased the price of Medicare by
من یه نکته اینجا اشاره کنم. اولین سوالی که بنت از کندی پرسی سوال خیلی عجیب بود که آیا تو گفتی واکسن کووید یک سلاح، یک ابزاریه که تولید شده تا هدفمند آدم‌های سفید پوست و سیاه پوست رو هدف قرار بده و یهودی‌های اشکنازی رو هدف قرار نمیده، یعنی یهودی‌ها کووید نمیگیرن؟ که کندی گفت من یه چیز دیگه گفتم، حالا یه بخشی از حرف بوده که تو داری تقطیع میکنی و توضیح میدی. چیزهای خیلی عجیبی قراره تو این جلسه بشنوی.
And to transition to a value-based system rather than a fee-based system,
So on
rather than a service-based system.
On Medicaid in particular, can you just kind of take those kind of general principles and apply it to the Medicaid program?
You know, listen, I think that there are many options with telemedicine, with AI right now. And, you know, there's including direct primary care systems. We're seeing that movement.
این توضیح بدم وسط همه برنامه ها، حتی برنامه زنده هم تبلیغ پخش میشه و این تبلیغ راه درآمدزایی کاناله. میدونم شاید یه موقعی سخت باشه دیدنشون، تحمل کردنشون، ولی اگه تحمل بکنیم من واقعا قدردانتونم برای اینکه کمک میکنیم به اینکه کانال بتونه درآمد داشته باشه.
The ultimate goal, which is value-based care, which is transparency, accountability, access.
And one more thing, going back to Medicare, you mentioned you're an MA. You mentioned earlier the Medicare fee for service. Do you have any kind of thoughts as to whether or not patients on fee for service should move into MA, or how should we handle that?
Whether patients
who are on Medicare fee for service.
Traditional Medicare?
Yes.
That's their choice right now. I mean, we have, I think, 32 million Americans, or 30 million Americans on Medicare, on traditional Medicare, and then another 34 or 34 on Medicare Advantage, roughly half and half. And I think more people would rather be on Medicare Advantage because it offers very good services. But people can't afford it. It's much more expensive. Oh, in answer to your first question, there are all kinds of exciting things that we can be doing, including cooperatives, which President Trump has supported, including health savings accounts, which President Trump has supported. All of these things to make people more accountable for their own health.
And so we'd bring the cooperatives and the health savings accounts into Medicare and Medicaid?
Exactly. We try to increase those, the use of those, and to direct primary care.
در مورد جزئیات
to continue to transition into a value-based program that is private. Americans don't, by and large, do not like the Affordable Care Act. People are on it. They don't like Medicaid. They like Medicare. And they like private insurance. We need to listen to what they would prefer to be on private insurance. Most Americans, if they can afford to be,
بیشتر آمریکایی‌ها ترجیح میدن بیمه خصوصی داشته باشن تا اینکه از بیمه دولتی مدیکیل یا مدیکیل استفاده بکنن.
Improve care, particularly for elderly, for veterans, for the poor in this country. And Medicaid, the current model is not doing that. I would ask, any of the Democrats who are chuckling just now, do you think all that money, the $900 billion that we're sending to Medicaid every year, has made Americans healthy? Do we think it's working for anybody? Are the premiums low enough?
سوال میکنه فکر میکنید $900 میلیون که ما برای مدیکید هزینه میکنیم فایده داره و کسی ازش راضی هست؟ خب بریم سراغ دموکرات دیگه و یه مقدار تنش بیشتر. سناتور ورنر فکر میکنم سناتور ویرجینیاست، دموکرات.
And if there was a new plan that was to be the basis of what Trump was going to do in repealing Obamacare, I would have thought by now we'd have seen it. I got to tell you, listen,
Senator, can I reply to that?
Senator, Mr. Kennedy, I got questions. I appreciate our visit. I know
به این اشاره میکنه که ترامپ برای
seriously.
جایگزین کردن اوباما
And I
کیش
don't
برنامه‌ای
reflexively vote. I
نداشت. اگه
voted
داشت تا الان
for
داده
four
بود.
President Trump's nominees already. Got a lot of grief from folks on this panel. But I got to tell you, I saw an email that you put out Monday night, or your campaign did, in a fundraising email. Your presidential campaign celebrated that the freeze on all new regulations, guidance, and announcements is a way to protect unelected bureaucrats from further undermining our health freedom. Then you ask your donors to help pay for your campaign.
وارنر سناتور
Your campaign,
دموکرات
and you put out that.
ویرجینیاست.
I don't think my campaign exists anymore.
All right, well, listen, I got to tell you this. Somebody's out there soliciting money for it.
میگه من یه
Maybe you ought to
ایمیل
find out who
میگه من یه
is.
ایمیل گرفتم از کمپین تو که گفته
fact,
چقدر
you
خوب که
celebrate
کمک‌های
this freeze.
فدرال متوقف
You think
شده.
that was a good idea to put all of this on hold for 90 days?
و
Funding and
کندی میگه من
any
اصلا
kind of
کمپینی
further
الان
work?
ندارم که ایمیل
NIH
بزنم.
research?
As Chairman Crapo pointed
What do
out,
you, I'm not asking for, I love Mike Crapo. I'm asking you. You're up for a very important position.
as he pointed out, Senator, the
right,
the
let me
portals
just-
that were closed were not closed as a result
یه
of
تو
the Trump
موافقی
Let me
که
just tell you. I'd like
کمک‌های
excuse me, sir. I'd like you to explain
دولتی برای
to a domestic
NIH
violence
تحقیقات
center in
درمانی و
Richmond
پزشکی
that's saying because
متوقف
this
بشه.
freeze
ظاهرا
they have
این
to close
کمک‌ها
down
متوقف شد برای
where those
چند
battered
روز.
women to go. Or a rural nonprofit
فرصت
I've
نمیده
got in
کندی
Chinook
باز
Valley
حرف
saying
بزنه.
that freeze is going to potentially shut down their ability to operate. So I guess if you deny or don't know what your campaign's sending on, you don't know if you raised a lot of money Monday night.
I'm saying that the Trump administration
You don't know if
has-
you raised a lot of money.
the Trump administration has made clear that it does not want to freeze benefits
All right,
for
excuse me.
any Americans under Medicaid or Medicare, and I do not want to
There
dismantle
are, the
Medicaid.
freeze is
یه
affecting
دولت ترامپ
beyond
نمیخواد
Medicare
کمک‌های
and
مدیکر یا
Social
مدیکید
Security.
رو متوقف
I would
بکنه.
hope you would have known that to be able to answer some of this. Now, you've said publicly,
ببین چقدر به
you want
دموکرات
to
فشار
immediately
اومده سر
get rid of 600
تعلیق
NIH
کردن چند
workers
روز کمک‌های مالی
on job
دولت
one, on
فدرال.
day one. When we had our meeting, you said you'd actually like to get rid of 2,200 people from HHS. Which offices are you going to start cutting and riffing these 2,200 workers from?
Senator,
گفته
there's
من
200
2200 نفر
political
میخوام از
appointees.
وزارت سلامت اخراج
So if
بکنم.
you got rid
میگه
of those 200
کی این
political
آدم
appointees,
چه
you're not
آدمایی
going to
میخوای
replace them with
اخراج
your
بکنی؟
political appointees.
Well, President Biden this year changed 3,000 employees at HHS, 3,750
So
at
you're
NIH.
2,200. What departments are you going to pick them
میگه
from?
بایدن 3000 کارمند وزارت سلامت رو عوض کرد.
He changed 3,000 out.
و من هم میخوام
Let me
2000
just-
نفر
I'm
عوض
down
کنم.
to a minute 30. The chairman's been generous with colleagues on both sides and may have to go a couple minutes over. But let me just say, so
چرا
let's just
نباید
answer.
بتونه اخراج کنه
This would
چند
be,
نفر؟
this,
خیلی
I hope, since you're
منطقی به عنوان
asking to
وزیر
become
خودش افرادی که
the
میخواد
top
انتخاب کنه.
healthcare official in the United States in terms of HHS, huge ramifications. And part of this job is to be the senior advisor to the president on health issues. So
میگه تو
when
شغل
we're
خیلی
looking at
مهمی
this
داری
purge and we're looking at
قرار
laying off
مشاوره با
workers
رئیس
and we're
جمهور بدی
looking
در
at
مورد
potentially the
سلامت.
president's illegal offer to try to buy out federal employees, which I would say to any federal employees, think twice. Has this individual in his business world ever fulfilled his contracts or obligations to
امروز
any
خبر اومده
workers
که
in the past?
دولت ترامپ
But
به
if you
همه
are
کارمندای
in this
فدرال
position,
گفته ما
will you pledge that you will not
بهتون
fire
پول
federal
میدیم که برین
employees who work
خونه
on food safety,
و کنارگیری
work on trying to
بکنید.
preventing things like
تا چند
salmonella?
ماه بهتون حقوق میدیم کنارگیری
Senator,
بکنید.
there's 91,000 employees.
So that I
at
take that as
HHS.
that's a simple yes, and I'm going
You
to take
think
that as
I
a
can
no.
run that
I take that
agency
as a
without
no.
getting rid of some-
Will you actually? We talked about protecting Americans from cyber criminals, something we need to do a lot more on. Will you commit not to fire anyone in the health arena who currently works on protecting
جلسه
Americans from
گفتگو و
cyber attacks
بررسی
in your
صلاحیت
healthcare
بیشتر
file?
جلسه
I will commit
داد کشیدنه.
not firing anybody who's doing their job.
کندی میگه
Based
هر
on
کسی که
your
کارشو
opinion,
درست انجام بده من
Based
اخراجش
upon your
نمیکنم.
opinion or your political agenda or Mr. Trump's political agenda?
Based upon my opinion.
So I guess that means a lot of the folks who've had any type of views on vaccines will be out of work. Will you
کندی میگه من بر
freeze
اساس
grant
نظر
funding for
خودم هر
community
کسی که
health
درست
centers?
کار کنه رو اخراج نمیکنم.
Will you freeze federal funds for community health centers the way the current administration has done?
The White House has made clear And no funds are going to be denied to any American
باز
for
وارنر سوال
benefits.
میکنه که
Listen,
میخوای
any
کمک‌های
program-
Do you know
درمانی
what
رو
happens
قطع
at community
بکنی.
health centers? Those are direct.
Are you talking about the Indian health centers?
No, I'm talking about community health centers across the country.
I understand that. I mean, I strongly
So you're going to
support-
excuse Indian health centers, which is good, but others are not. They're going to get their funds frozen.
I strongly support community health centers, as does the president. He
So does that
not
mean
want-
you're not going to freeze the funding that is currently frozen?
The White
Or
House
work
has
done,
made
freeze it?
clear that none of that funding is supposed to be frozen.
Sir, the direct payments are different than how the government operates. We fund the federal government down to community health centers. As a former governor, there's lots and lots of state programs that are related to healthcare
فعلا دارن
that come from the
فشار
federal government,
میارن
come down to the state, then it goes
به
to local
کندی سر
programs.
بحث
All of those
قطع شدن
don't
یک سری
directly
از
pay out
کمک‌های مالی
$1
دولت
at a
فدرال به
time,
مراکز
but they
درمانی
come
در
from
آمریکا.
federal funding. They are all, you know,
هدف
even though they
قطع
keep
شدن این بود
changing the
که
guidance on a minute-by-minute basis,
بررسی بشه
based
هزینه‌ها،
upon 9:45
هزینه‌های
or 10:30 or
اضافی
10:45,
کات بشه،
whatever
قطع
time it is
بشه.
today, those funds are still frozen. Sir, I just honestly, I want to give you a fair shot, but I don't feel like
میگه من میخوام
approach this
عادلانه با تو
job with the
رفتار بکنم. همه
knowledge
خنده‌شون
and
میگیره
candidly,
حسام.
your willingness not to commit, try to recommend to the president to make sure these funds are unfrozen and that people's lives are at stake is a very disappointing answer. Thank you, Mr. Chairman.
واقعا شرم‌آوره
Senator Langford.
این نحوه
Chairman,
سوال
thank you.
کردن که نمیذارن
Mr. Kennedy, it's good to see you again. We
یه
had some great
جمله
visits in
کندی
my
تا حالا
office.
فکر
We've
نمی‌کنم
done some
تونسته
follow-up
باشه
calls to be able to go through.
سه تا
You and I
جمله
have
پشت
talked
سر هم
about
بگه
100 different issues and backgrounds and things. You've been able to address a lot of them today and just different questions to be able to clear up social media rumors
لنگفورد
and the things that
سناتور
are out there.
جمهوری
So I do
خواه
appreciate that.
فکر
We've talked
میکنم
about pharmacy
اوکلاهاماست.
benefit managers. We've talked about the nursing home rule the Biden administration put down. We talked about your views on agriculture and commercial and row crop agriculture. We've talked about food issues, and you made it very, very clear. You're not going to tell Americans what to eat, but you do want Americans to know what they're eating. And I think that's a pretty fair perspective on that. I do want to talk to you about some areas that you and I have talked about as well. We have some disagreements, you and I, on the issue of life. And when life begins on that, you've been very outspoken on that.
میره سراغ بحث
And we've
سفت
had some good
جنین.
opportunities to be able to talk
میگه ما یه
about
مقدار
that.
نگرشم
Title
در
10
مورد
is
اینکه زندگی از کی
specifically
شروع
in the
میشه
HHS area.
متفاوته.
This has been an area that has been interpreted for a long time, and President Trump in the first administration interpreted that rule to say that his administration will prohibit the performance, referral for, or promotion of abortion as a part of the Title X program. That he made that very clear in the first administration. Obviously, that's his decision to make again on that, on how he wants to handle that, and he's made a lot of public statements on that. The Biden administration not only reversed that, not only rescinded that rule, but they went one step the other direction. In my state in Oklahoma, as you and I have talked about, the Biden administration cut off funding to the state of Oklahoma for AIDS testing, for breast cancer screening, and for other areas of poverty health care because my state didn't promote abortion. It wouldn't provide.
لنگفورد میگه دولت بایدن کمک‌های درمانی به اوکلاهاما برای ایدز و سرطان پستان رو قطع کرده به خاطر اینکه اوکلاهاما حاضر نشده از سفت جنین بیشتر حمایت بکنه. دولت بایدن تصمیم گرفت.
For those that are in rural health care, how are you going to handle Title X?
I'm going to support President Trump's policies on Title X. I agree with President Trump that every abortion is a tragedy. I agree with him that we cannot be a moral nation if we have 1.2 million abortions a year. I agree with him that the states should control abortion.
ایالت‌ها باید سفت جنین رو کنترل بکنن.
He wants to end late-term abortions. And he wants to protect conscious exemptions, and that he wants to end federal funding for abortions here or abroad. That's Title 10.
حمایت مالی فدرال سفت جنین رو می‌خوایم قطع بکنیم به این اشاره می‌کنیم که
Thank you for that.
میگه ترامپ از این حمایت
When he
می‌کنه.
came in, immediately closed down the Office of Civil Rights and Conscience Protections within HHS. There's a statement that's come out recently that he's going to reopen that office again to be able to protect the civil rights of Americans. One of the things that Javier Becerra did immediately when he came into HHS was conscience protections for medical professionals that were being compelled against their conscience to perform medical procedures that violated their conscience. Javier Becerra stepped in immediately into HHS and withdrew that. and said, no, the federal government will tell you what you believe about these issues.
یه
You don't
دفتری
have
وجود
conscience
داره تو
protections
وزارت
anymore
سلامت
and refuse to
آمریکا
protect those folks.
که پزشکان
Would you step
میگه
in and say that
شما
healthcare
مجبورین
individuals
حتی برخلاف
have the right
عقیده
of
شخصتون
conscience
سفت
again,
جایی
as the
انجام
federal law
بدین و اگه
allows?
انجام
Yeah, I
ندین
mean, the first thing that occurs to me when you ask
تبعاتی
that
داره.
question is
دولت
what
بایدن واقعا
patient
شگفت
would
انگیزه.
want
هر روز فاجعه
somebody
جدید
doing a
درش میفهمه.
surgery on them that, you know, believes that the surgery is against their conscience being forced to perform that. I don't know anybody who would want to have a doctor performing a surgery that the doctor is morally opposed to. Listen, I
فکر
came
می‌کنم
from
هیچ
a
کس بخواد
family that was
پزشکی
split
روش عملی
on
انجام بده که از
life
نظر
and
اخلاقی اون
choice.
پزشک راضی نیست اون کار
I
انجام بده.
have cousins today who believe that abortion at any stage is equivalent to homicide. Now, there are other people who believe the opposite. But the good thing in my family that I really loved is that we were able to have those conversations and respect each other. And I wish that we could do that nationally. And
امیدوارم بتونیم تو سطح ملی مثل
forcing
خانواده من در مورد
somebody
سفت جایین گفتگو کنیم و به هم احترام بذاریم.
participate in a medical procedure as a provider that they believe is murder does not make any sense to me. We need to welcome diversity in this country. We need to respect diversity. And we need to respect each other when we have different opinions and not force our opinions on other people.
Yeah, thank you for that. The FDA, under the Biden administration, changed the rules for the chemical abortion drug and said you no longer need to see a physician. So if you have an ectopic pregnancy or all kinds of other, don't even go anymore to see a physician. But they also changed an area that has been, something that's been very particular, you've talked about a lot, and that's transparency. They changed the position and said, don't tell us if there's a side effect on this drug unless she dies. But other than that, don't tell us anymore. Literally, don't give transparent information to the American people or to the women who take this drug anymore.
یه
We
قانونی
don't want that
گذاشته
reported.
که شرکت‌هایی
My
که
question
داروی
to you
سفت جنین
is,
تولید میکنن
will
بهشون
FDA
گفته
move to be
اگر
able to actually
داروی
give transparency to the
عوارض
American people
جانبی
and
داره
say,
بهمون
this drug is no
نگید
different than
تا
any other
زمانی
drug.
که
We
یک
don't
زنی
longer
بمیره
protect it
وقتی
just 'cause
مرد
it's
بگین چه
political
عوارض
for
جانبی
some
داشته
folks. People
برای اینکه
should
سفت جنین
know
کم نشه.
side effects on this drug and there should be reporting.
Yeah, I mean, it's against everything we believe in this country that patients or doctors should not be reporting adverse events. We need to know what adverse events are. We need to understand the safety of every drug,
دولت بایدن به
and every other drug.
شرکت‌های دارویی گفته عوارض جانبی داروی سفت جنین اطلاع ندین به بیماران.
One of the things he is not taking a position yet on mifepristone, a detailed position, but he's made it clear to me that he wants me to look at safety issues, and I'll ask NIH and FDA to do that.
Thank you.
Senator Whitehouse.
خب بریم وایت هاوس. دموکرات
Mr. Kennedy, I only have
رود آیلند اگه اشتباه نکنم.
5 minutes with you, and I've got a lot of experience with CMS, so you're just going to have to listen. Two things. One, if you want to move from advocacy to public responsibility, Americans are going to need to hear a clear and trustworthy recantation of what you have said on vaccinations, including a promise from you never to say vaccines aren't medically safe when they in fact are, and making indisputably clear that you support mandatory vaccinations against diseases where that will keep people safe. You're in that hole pretty deep. We've just had a measles case in Rhode Island, the first since 2013.
تعهد بدی که واکسنایی که اجباری هست رو اعمال بکنی برای جلوگیری از بیماری‌ها اگه می‌خوای وزیر بشی.
I want to air harms
گفتم می‌خوام
that
حرف
Rhode
بزنم.
Island
خیلی
has
احتمالاً سوال
experienced
نمی‌پرسم.
from a remorseless,
رأی‌گیری احتمالاً
CMS
هفته آینده باید
bureaucracy.
انجام بشه. تاریخ دقیقی براش تعیین
CMS has
نکردن.
for years maintained a reimbursement system that the bureaucracy could never
یکی از
explain,
دوستان
never
سوال کرده بود تو
justify,
چت که پیش
that
بینی‌ها چیه. من حالا
persistently
دارم
pays Rhode
الان
Island
می‌بینم
providers less
بحثی شده
than
توی
neighboring Massachusetts and
سایت‌ها و شبکه‌های
Connecticut
اجتماعی
providers.
در مورد رأی ها فعلا من چیزی ندیدم که چطور میخوان رأی بدن این سناتورهای مختلف.
in our regional healthcare market. The pending AHEAD program can begin to remedy this, at least for value-based care, and it must. There has to be payment parity in the region. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid, and the one act CMS took on this years ago was to make it worse. The CMS bureaucracy has also attacked one of the best accountable care organizations in the country, Rhode Island's Integra family doctors. Tried to throw them off the shared savings program because they said Integra years ago briefly fell 137 patients short of the 5,000 patients that ACOs need. CMS wouldn't listen until a court found that to be unjustified, likely illegal, irreparable harm to this high-performing ACO and its patients, and contrary to the public interest. That must stop. Last, CMS has refused to approve waivers granted elsewhere for Rhode Island from rules that are stupid for Medicare patients who are nearing the end of their days. Here's what families see. Granny is home dying. She needs to transfer to a nursing home. And Medicare insists on putting her 3 days and 2 nights in a hospital. Expensive, frightening to
آره
Granny
تو این
and the
جلسه فقط
family,
سناتورها
and
صحبت
stupid.
میکنن دیگه. هر سناتور من دقیقه
Granny's home
سوال
dying and can't
میپرسه
get palliative and curative care together. Inhumane.
در نهایت
and
کمیته
stupid.
تصمیم میگیره رأی گیری میکنه که
Granny's home dying and can't get home care.
آیا این کاندیدا
If she can
میتونه
still
به
get out into the
یک
yard
مرحله جلوتر توی
or
صحن
be
در
driven to
موردش
see
رأی
the
گیری
shore,
بشه
to see Narragansett Beach, say.
که با توجه به اینکه اکثریت
One more
جمهوری خواهان
time, to
احتمالاً
recall childhood memories
اگه
before
اتفاق
she
خاص
dies.
نیفته رأی میاره.
Inhumane and stupid. Granny's home dying and the family's exhausted. And the respite care benefit is not to send a nurse or a caregiver, but to stuff Granny in an ambulance and haul her off to a hospital.
شاید واقعا
Some respite.
وایت هاوس میتونست اینا رو توی
It's
جلسه
all
خصوصی توضیح بده براش. این
expensive,
فرصت
frightening, inhumane,
سوال
and
کردنه.
stupid. But the insensate CMS bureaucracy
رأی
takes a
گیری
court order
برای
to be awakened
تایید کندی
to the harm
هنوز تاریخش
they
مشخص
cause.
نشده که انجام میشه.
I have had
روال
enough.
اینطوریه که توی کمیته
CMS should let Rhode Island try humane
روال تایید هر فرد توی سنا اینطوریه که توی کمیته بحث میشه در مورد اون فرد. الان توی کمیته فایننس یا مالی داره بحث میشه. فردا کندی جلسه دیگه داره تو کمیته سلامت و آموزش سنا. معمولا بعد از 2-3 جلسه توی کمیته ها رهبر اکثریت سنا یه تاریخی تعیین میکنه و در صحن سنا رأیگیری با حضور همه سناتورها انجام میشه که این تاریخ هنوز تعیین نشده. این جلسه که میبینیم فعلا جلسه سوال و جوابه که هر سناتور چند دقیقه سوال میکنه.
I'm an implacable enemy of tyrannical,
کندی میگه توضیح میخوام بدم.
bureaucracies and stupid rules, and I will work with you to make
کندی میگه من دشمن بوروکراسی به در
CMS
نخورم و با تو همکاری میکنم برای اینکه نقش‌های غیر مفید از بین ببریم.
Plan. And it is the template for what we ought to be doing is a value-based plan. And I look forward to you to making sure that we create pilot programs like this.
Unfortunately, Mr. Chairman,
around the country.
Unfortunately, Mr. Chairman, one of the things I've learned in my tenure in the Senate is that a nominee saying that they're willing to work with me amounts to exactly 0. We need to get this fixed. Thank you.
خیلی عالی. وایت هاوس میگه تجربه من میگه که خیلی همکاری وجود نداره. وقتی کاندیدا میگه همکاری میکنم
Mr. Kennedy, I'm glad to see you here this morning. I listened to your opening remarks and you mentioned you want to make HHS the gold standard of science. I have found my engagements with you, both behind closed doors in my office, as well as listening to you publicly, to be very thoughtful and science-based.
یه گفتگاه
I
خیلی
applaud that. I thank you for
عمیق،
that. And I
مبتنی بر
realize
علمی
this
با
will
هم دیگه
likely be a very
داشتیم.
partisan vote on this committee and on the Senate floor. But let the record state there are 3 medical doctors on this side of the dais. I'm a chemical engineer. We believe in science. I'm thankful that you do too, and you made that comment in your opening
یا مهندس
remarks.
شیمی هم فکر میکنم به علم باور دارم و
I want to
قدردان
talk about
صحبت‌های تو هستم.
agriculture for a moment. We talked about our common love for Montana. You've been to Montana many times. It's a wonderful state.
این
A lot
سناتور
of folks have
ایالت
discovered it.
مونتاناست.
They watch the show Yellowstone, and people are coming and
بحث
moving to our
کشاورزی اونجا
state.
خیلی
But
مهمه.
it's
در
an
مورد
amazing
کشاورزی می‌خواد
place.
سوال کنم.
But as you know, agriculture is our top economic driver in Montana. We produce some of the highest quality crops, the best livestock in the country and the world. Our farmers and our ranchers are truly some of the most effective environmental stewards in ensuring we
کشاورزی
have
مونتانا
a
تعریف
safe
میکنه که
food supply
بهترین توی
chain
آمریکا و
in the
جهان.
world. I share your view that protecting the integrity and safety of our food supply is of utmost importance. I appreciate the research happening in places like Montana State University to help farmers produce resilient, healthy, and safe crops, as well as their agricultural practices. You mentioned you were a 4-H kid growing up. I think our 4-H kids and our FFA kids are some of the best kids in America. My question for you, Mr. Kennedy, is if confirmed, as I'm listening to my farmers and ranchers talk about the future, will you commit to working collaboratively with partners at USDA, at the relevant federal agencies, as well as our Montana farmers and ranchers, before implementing any policy that might affect or impact?
یا حاضری همکاری بکنیم با وزارت کشاورزی برای سیاست‌های بحث کشاورزی.
I have, as I shared with you, a personal commitment and a long career working with farmers. I want to make sure I understand the very, very narrow margins, the slim margins that American farmers and ranchers are dealing with. And I don't want under my watch a single farmer to have to leave the farm for economic reasons or for regulatory or bureaucratic reasons.
سناتورها میان از کاندیدا سوال میکنن که آیا حاضری تعهد داری روی این موضوع کار بکنی؟ جواب اون فرد معمولا مثبته که بله باتون همکاری میکنم. هدف اینه که اون سناتور دغدغه‌های خودش رو بگه، میگه من اولویتم این موضوع و میخوام روی این موضوع وقت بذاری، کار بکنی که رأی من داشته باشی.
The best farm president in our history. Farm income spiked for the first time in decades under his last administration. He got solid support from farmers across the country. Farm country is Trump country. Farmers across the country supported him during this election.
میگه
He
کشاورزای
has
آمریکایی
specifically instructed me
از ترامپ حمایت
that he
میکنن
wants farmers involved in every policy.
و خود ترامپ گفته کشاورزا تو سیاست‌گذاری مشارکت داشته باشن.
Make sure that we preserve American farmers, that all of our policies support them.
Mr. Kennedy, thank you. And if confirmed, I look forward to having you and Brooke Rollins out to Montana to spend some time with
You
our
have
farmers.
my commitment to come there anytime, particularly during ski
امیدوارم تو
season
و
or
وزیر
hunting season.
کشاورزی بیاین مونتانا رو ببینیم.
I want to shift gears for a moment. As we discussed in the meeting we had in my office, mifepristone was approved in 2000. The FDA has been under scrutiny and brought to court
خب باز میریم
for
سراغ بحث
failure to
داروی
properly
سخت
assess
جنین.
this drug, as well as subsequent deregulations Senator Langford described that have occurred over the past 25 years. Some of these deregulations included ending the requirement that these drugs be prescribed by a doctor, ending reporting requirements for
دموکرات‌ها تو این
adverse
سالا اومدن
events,
مقررات
and
داروهای
allowing
سفت
these
جنین هی
pills to be
کاهش دادن.
obtained through the mail.
مثلا اینکه دیگه
In
دکتر
fact,
لازم
the
نیست داروی سفت
FDA's
جنین بنویسه.
own prescribing label mentioned that 3 to 5% of women taking this drug end up in the emergency room. My question is, if confirmed as Secretary of HHS, will you commit to working with the FDA Commission to review these deregulatory actions that are
میگه آیا به عنوان
threatening the
وزیر میاد
safety
کار
of
بکنی با
women?
FDA برای اینکه مقررات سخت جنین بهینه تر بشه برای بحث سلامتی زنان.
As I said to Senator Langford, I think it's immoral to have a policy where patients are not allowed to report adverse events and where doctors are discouraged.
که غیر اخلاقیه که
President Trump has asked me to study
گزارش
the
نشه به
safety
بیمار
of
که دارو چه
nifedipine.
اثرات جانبی میتونه
He
داشته
has
باشه.
not yet taken a stand on how to regulate it. Whatever he does, I will implement those policies, and I will work with this committee, make those policies make sense.
Thank you, Mr. Kennedy.
Senator Hassan.
Thank you, Mr. Chair and Ranking Member Wyden, and welcome, Mr. Kennedy, and to your family as well. I want to start with a couple of concerns I have, and just briefly, on Medicaid. States share in the funding of Medicaid. Millions of disabled children in this country are alive because of Medicaid. Millions of people with addiction in this country are in recovery because of the services provided to them by Medicaid. And millions of chronically ill people who, until Medicaid expansion was enacted, who couldn't get health care and therefore couldn't work because they were too sick, got health care through Medicaid expansion, then went back to work, and now they're on private insurance. So those are some facts about Medicaid that you might want to brush up on. Now, I'm also extremely concerned about your endorsement of radical fringe conspiracies that if implemented at HHS would put American families' lives at risk. Vaccines are one of our greatest public health triumphs. And you don't need, I'm not talking about abstract medical science. One of the people who helped raise me was my grandfather, who was a pediatrician. He practiced medicine in this country from 1921 until the mid-1980s. And I heard details about the difference those vaccines made in saving lives in the children who were under his care. Vaccination has helped to eradicate many deadly diseases in the United States, including polio and smallpox, something we should be proud of as Americans. I am extremely concerned that as Secretary, you would be able to halt critical vaccine research and to exploit parents' natural worries by advising them not to vaccinate their children. This will lead to more children getting sick, and some will even die. Before the measles vaccine, about 500 American children died a year from measles. This is too much of a risk for our country, and there is no reason that any of us should believe that you have reversed the anti-vaccine views that you have promoted for 25 years. For example, you have previously falsely suggested that the polio vaccine killed many, 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 many more people than polio ever did by causing fatal cancers, while rigorous safety studies show that to be completely false. Now, let's go to something we agree upon. I am really heartened to see that one area where we agree on is on women's reproductive freedom. In your own words, it's not the government's place to tell people what to do with their bodies. You said that, correct? Yeah. Mr. Kennedy, in 2023, you came to New Hampshire and said, quote, I'm pro-choice. I don't think the government has any business telling people what they can or cannot do with their body. So you said that, right? But you also said we need to trust the women to make that choice because I don't trust government to make any choices. You said that too, right?
Yes.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right, so, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that regardless of what you believe, regardless of what values you have, if President Trump tells you to do something, you're going to do it.
سوالش نمیگه اگه ترامپ بگه هر کاری انجام بدی بدون توجه به ارزشات همون کار انجام میدی چیزی که ترامپ بگه رو.
Here are the safety studies that tell us mifepristone is safe and effective. And I ask Mr. Chair that these 40 about 40
این تحقیقاتی
studies
نشون میده یه
be
قرص
admitted to the
سفت
record
جنین
by
سالم و
unanimous
مشکلی
consent.
نداره.
Without objection.
So the studies are there. The safety is proved. The science is there. But what you're telling us is if President Trump orders you to take action to make it harder for women to get
اگه ترامپ دستور
direly
بده
needed health care,
دسترسی به این
you'll
قرص
follow
سفت
his
جنین
order.
سخت‌تر
If
بکنی
Mr.
دستورش رو دنبال
Trump,
میکنی.
as he did yesterday, orders a halt on Medicaid payments that are essential for taking care of people with disabilities all around this country, you're going to follow that order because you are willing to sacrifice your values, your knowledge, if President Trump tells you to do that. That, to me, is unacceptable in a Secretary of Health and Human Services.
As I explained before, the White House has issued a statement saying that that policy will not deprive any American of benefits.
The problem is the White House issued that statement only after we pointed out the damage it would do, and it became politically uncomfortable for them. You know what else that freeze on federal funding did? It halted funds for critical research that could cure pediatric cancer. So if the president tells you to do that, you're going to stop that too. That's enough.
That's enough.
Senator Cortez Masto is next.
Thank you. Mr. Kennedy, thank you for coming into my office and having the conversation that we did. I appreciate your passion.
خب سناتور کورتز مستو فکر کنم سناتور نواداست اگه اشتباه نکنم دموکرات.
About the issues that matter to you, and I appreciate that. Let me ask you a couple of questions, though I just need some clarification. Right now, there's a 40-year-old law that requires hospital ERs accepting payment from Medicare to actually provide emergency care to patients. So let's say a woman experiencing a life-threatening condition like a heart attack goes to the ER. As a lawyer, you would agree that that federal law protects her right to emergency care, correct?
Yes.
So now a pregnant woman with life-threatening bleeding from an incomplete miscarriage goes to the ER. Let me rephrase that so you can hear. A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned. You would agree also as an attorney that federal law protects her right to that emergency care, correct?
I don't know. I mean, the answer to that is I don't know if the state bans it.
Well, let me ask you this as an attorney. Doesn't federal law preempt state law?
The federal Constitution does. Sometimes not every federal law preempts state laws. It could be unconstitutional. I'm not trying to be evasive, Senator. I'm just telling you I don't know the answer to that question.
میگه نمیدونم واقعا جوابش چیه. سوال اینه که اگر قانون فدرال بگه که سخت جنین ممنوع میشه و ایالت بگه ممنوع نیست بیمارستان باید چیکار بکنه؟
To make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients when they present. It's actually the EMTALA law. So what authority as HHS director do you have with respect to EMTALA?
My understanding is that I have budgetary power and that it's pretty much limited to that. But if you tell me I have another authority, I don't even think that.
Well, let me tell you,
we have a law enforcement branch at HHS.
Actually, you do, and that's CMS. CMS actually investigates complaints of EMTALA violations, as well as the Health and Human Services Inspector General, who, by the way, was just recently fired by Donald Trump. So you will be enforcing EMTALA laws.
اتفاقی افتاده اینه یه قانون فدرال وجود داره مال 40 سال پیش که اگه یه زنی بیاد تو اورژانس باید به سرویس بدن. حالا اگه اون سرویس سخت جنینه و توی ایالت اون سخت جنین ممنوع شده باز بیمارستان به خاطر اینکه قانون فدرال ارشدتره باید به سرویس بده. یه همچین بحث ظریف قضایی رو داره مطرح میکنه.
And I think you're sincere in your belief that you want to reduce prices for Americans, correct?
Yes.
Yeah. The Inflation Reduction Act empowered Medicare to negotiate prescription drug prices.
یه میخوای قیمت داروها رو کاهش بدی،
Penalizes
درسته؟
drug companies for price hikes above inflation, and it caps seniors' out-of-pocket drug costs, along with reducing insulin prices to $35 per month. But your future boss, Donald Trump, on his first day in office, revoked President Biden's executive order that actually directed the health secretary to examine ways to reduce drug prices
اجرای
and
بایدن رو
improve
لغو کرده
access
که
to
قیمت
innovative
داروها رو
therapies
میتونست
for
کاهش
the
بده.
American people. And unfortunately, Republicans in Congress want to repeal the Inflation Reduction Act, which means reversing all of
داره
those things that we
مصوبه
worked on
کاهش
to
تورم
lower
اشاره میکنه
prices
که
for
در زمان
Americans.
بایدن تصویب
So my
شد و
question to
اتفاقا
you
تورم تو
is,
آمریکا افزایش داد. داره
what
از
do
اون
you
دفاع
do?
میکنه.
Why are you there? Are you there to be a rubber stamp to this administration and cave into all of these positions that they're taking, even though you know they're in disagreement with your positions on lowering drug prices and that they could harm
انتظار دارن
Americans? How do you
وزرای
handle that as
ترامپ
HHS
دشمنای
director?
ترامپ باشن و در مقابلش
Senator, my
بیستن.
understanding
ولی از وزرای
is
بایدن
that the
همچین
White
انتظاری
House
ندارن که
issued
به
an
رئیس جمهور
executive order, I
نبگن.
believe today, supporting the drug negotiations under the IRA. President Trump was very aggressive during his first term about negotiating drug prices. He has instructed me, and I've met with him repeatedly on this, that we need lower prices for seniors in this country.
توی جلسات هیرینگ سنا ما مدام اینو میبینیم که دموکرات ها به کاندیداهای ترامپ میگن آیا شما از ترامپ تبعیت میکنید یا نه؟ مشخصه که وزیر باید از رئیس جمهور تبعیت بکنه. خیلی عجیبیه که همچین انتظاری دارن که وزیر بیاد بگه نه من نگهش رئیس جمهور میخوام به چالش بکشم. و جالبه هیچ وقت از دموکرات همچین سوال شما نمیشنیدین که پرسیده بشه آیا تو رئیس جمهور رو به چالش میکشی؟
drug prices for Medicare so we can lower those prices for Americans?
My understanding is that the executive order that was issued today, which I haven't seen, but I've read a summary.
Well, let me ask you this then, because you keep citing the Trump administration and you're just going to follow what they say. Is that what you're doing? You're just a rubber stamp for them in this position? So anybody, so it doesn't matter that you're before us. It could be anybody coming before us as long as they're a rubber stamp for this administration and disregarding your beliefs and what you think. I guess my question to you is, if it really is fundamental to what you believe, how do you live with that? How do you address those issues as you're moving
باز تکرار
forward?
میکنه تو قراره تو فقط امضا بکنی مهر بکنی هر چیزی رو میگن.
No, I'm asking you.
Okay, President Trump has asked me to end the chronic disease epidemic and make America healthy again. And I'm in a unique position.
Is that the only reason why you're at HHS? Is that the only reason why then you're at the HHS to address that one issue?
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking.
یک کشتی داره غرق میشه به خاطر بحران سلامتی تو آمریکا داره. مهم نیست کی پولا بده، بیمه چیکار بکنه.
Budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world.
مشکل بیماری مزمن تو جهان داریم تو آمریکا.
We had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID,
4% جمعیت جهان داریم اما 16% مرگ‌های کووید داشتیم.
This is an existential threat economically to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.
به این دلیل من اینجا هستم. دست
Senator
میزنم.
Barrasso. Thanks so much, Mr. Chairman. Mr. Kennedy, thank you for taking time to visit with me in my office prior to today's hearing to talk about a lot of the
این
important
دیگه به
issues
نظرم یکی
affecting
از
healthcare in
بهترین
my home
بخش‌های
state
جلسه
of
امشب بود،
Wyoming as
جلسه که
well as the
دیدیم.
nation. And I appreciate your willingness to serve our country. During our meeting, we
کندی
discussed
سوالای
the challenges
خیلی
that healthcare
ناعادلانه ازش
providers and
پرسیده شد،
patients are
اتهامای
facing in
زیادی بهش
rural
زده
America.
شد
Financial obstacles facing rural
و اینجا به نظرم
hospitals,
خیلی
workforce
خوب از خودش
shortages,
دفاع کرد و
issues of
توضیح داد دلیلی که من
OBGYN,
اینجا
and new
هستم اینه که من یه
regulations that are
موقعیت
painful that
منحصر
have come
فرد
out of the
دارم
Biden
که
administration,
میتونم
hurting
با
our ability to
بحرانی
provide
که بقای
nursing home
آمریکا داره
staffing.
دچار
So let me
خطر
start, if
میکنه
I could, with
مقابله
rural
کنم و اون بحث
hospitals and the
بیماری‌های
closures of
مزمن
hospitals like
که
that.
اکثر جمعیت
There
آمریکا
are a
رو
lot
امروز
of
درگیر
challenges
کرده.
facing hospitals in rural communities and frontier areas. We have 33 hospitals in Wyoming.
بارسو
26 are really
سناتور
located in areas,
جمهوری خواه.
locations, often hard to get to. Weather impacts them. 6 of the hospitals are at risk of closing. 2 are at immediate risk of closing in the next 2 years. 10 have had to cut available services. And this is a concern of rural hospitals in both Republican and Democrat states, either way, bipartisan. Critical that the workforce challenges, financial challenges that we're facing are addressed. Can you commit to working with us on a plan to address the critical nationwide issue of rural health care?
Yes, yes, Senator.
بارسو در مورد
And I
سیستم
would
درمان
say
تو
that
روستاهای
during my
آمریکا
visits, I
سوال
visited
میکنه.
almost 60 senators so far. And the most common unifying, I would say, issue among both Democrats and Republicans, there were 2. One was PBM reform, and the other is rural hospitals. And, our nation made a commitment over 100 years ago to put up a hospital within 30 miles of every American. We generally succeeded in doing that. It's absolutely critical. It's life-saving. And rural hospitals are closing at an extraordinary rate right now. They not only provide important health care for the localities, but also they're economic drivers for localities all over this country. President Trump is determined to end the hemorrhage of rural hospitals, and he's asked me to do that through use of AI, through telemedicine, which these are innovations that I saw the other day. A Cleveland clinic has developed an AI nurse that you cannot distinguish from a human being, that has diagnostics as good as any doctor. And we can provide concierge care to every American in this country, even the remote parts of Wyoming, Montana, Alaska, et cetera. We also have opportunities at HRSA
پوشش درمان رو به آمریکایی‌ها بدیم هر جایی که هست، حتی توی مناطق دورافتاده مثل وایومینگ یا مونتانا.
of providing personnel to rural hospitals, and I intend to use all of my power because I've seen the priority that is given by both Democrats and Republicans on this committee. I intend to make that a priority if I'm privileged to be confirmed.
Well, I appreciate it, because often with financial strains on a local hospital, one of the common services to be cut in rural hospitals is maternity services. So now we have women in Wyoming having to drive over 100 miles to access care. 13 counties in Wyoming don't have access to OB. And we're talking counties larger than the states of Vermont, New Hampshire, Rhode Island, Connecticut, New Jersey, Delaware, counties larger than those whole states. So will you commit to working with my office to find solutions to help address these specific maternal health challenges in rural America?
Yes, Senator, I look forward to
چالش بزرگ تو روستای
Another
آمریکا
issue
اینه
we
که
specifically spoke about with this harmful
کانتی ها و
Biden
شهرستان‌های خیلی
administration
بزرگی
rule
دارن
that
و
really
گاهی
been
اوقات
bad for our
بیمارستان‌ها
rural nursing
خدمات
homes.
نمیدن. آدم‌ها باید
And it's a rule that would triple
توی کانتی
the
اندازه
registered
مثلا
nurse
ایالت
requirements
نیوجرسی یا
in
نیو
nursing
همشایر
homes. This
جابجا
is-
بشن برای اینکه
we
برن به
just
جایی
aren't
که
enough
خدمات
registered
بهشون
nurses
بدن.
in our state to be able to comply with this. This would lead to nursing home closures across our state. Will you commit to working with me to fix this serious problem that it was a result of a rule that came out by the Biden administration, who clearly doesn't understand rural America?
Yes, Senator, I think the rule was well-intentioned, but as you've said, and I've heard from many rural senators, it will be a disaster for their states.
خب مشتبه میپرسه به نظر مثل حال جسمی کندی اصلا خوب نیست، توان درست حرف زدن و کنترل تنش بدنشون نداره، به نظرتون گزینه مناسبی هست واسه وزارت؟ سوال جالبیه. من ویدیوهای زیادی از کندی دیدم، پادکست های زیادی دیدم و به چیزی که الان به نظر میاد اینه که خوب اتفاقا مدیریت کرده. این با توجه به تنشی که وجود داره و سوالا و اتهامایی که مطرح شده شبیه چیزیه که من توی پادکست ها و گفتگوهای دیگه دیدمش، یعنی خیلی متفاوت نیست. برداشت من اینه که خیلی عجیب نیست حالتش، فکر میکنم خوب بوده تا اینجا. سیاوش میگه فکر میکنی کندی در کل موفق بود؟
was in reality for rural areas at least it is going to be a disaster.
انتظار این بود که دموکرات‌ها یه سری حملات خیلی شدیدی انجام بدن. شاید یه جاهایی رو میتونست به نظرم بهتر صحبت کنه، ولی با توجه به اینکه اونا نمیخوان گوش بدن و صرفا میخوان داد بکشن، چیزای متفاوتی هم میگفتی، بهتر هم توضیح میداد، نظراتش خیلی به نظرم فرقی نمیکرد. دموکرات‌ها قراره حمله بکنن، جمهوری‌خواها قراره دفاع بکنن، روال همیشه همینطور بوده. من به نظر میاد توضیحاتش خوب بود با توجه به اینکه نمیذاشن حرف بزنه. شاید یه جاهایی میتونست یکم بهتر توضیح بده نگرشش. جانسون سناتور جمهوری‌خواه ویسکانسین داره صحبت میکنه.
My first response was, Bobby, this is an answer to my prayers. We need to get to the answers of this, but even more, we need to heal and unify this divided nation.
جانسون میگه
I'm not necessarily the most
وقتی
optimistic
شنیدم
guy.
کندی قراره وزیر بشه حس کردم به دعاهام جواب داده شده.
But I thought, wow, here's somebody from the left, somebody I don't agree with on many issues politically, coming together with President Trump and focusing on an area of agreement, something that the American people
یه آدم چپگرا دموکرات مثل کندی حاضر شده با ترامپ کار کنه و روی موضوعی که دغدغه همه آمریکایی‌ها است، سلامت.
What is causing chronic illness?
و چی باعث اوتیسم میشه، چی باعث بیماری مزمن میشه توی آمریکا؟ این جواب اینا رو می‌خوایم پیدا کنیم.
I think I know the personal and political price you've paid for this decision. I want to say publicly, I thank you for that. I truly appreciate what you're doing here.
من خیلی قدردان کاری هستم داری انجام میدی.
Can't we come together as a nation and do this?
نمیشه به عنوان ملت کنار هم باشیم. یک بار.
Aren't you getting tired of this? I'm getting tired of this. So again,
خسته نشدین از این وضعیت، از این تنش و
I need to enter in the
اختلاف.
record. These are just 11 letters of support signed by 63,000 people, thousands of doctors.
این نامه هایی که هزاران پزشک امضا کردن، حمایت کردن از
North Carolina Physicians and Freedom Group, Governor Jeff Landry from Louisiana. These are Americans, nonpartisan. A lot of these people I know because I've advocated with you. A lot of them are Democrats. They put their political differences aside. So, Mr. Chairman, I'd like to enter this in the record.
Without objection.
I also do want to, Mr. Kennedy, as long as I have you here, I've written over 70 oversight letters to the federal health agencies under the Biden administration. I've virtually gotten squat out of them, okay? What I get is we get, for example, 50 pages of Anthony Fauci's emails redacted. Oh, by the way, the latest one was 17 pages. Instead of issuing a health alert on the myocarditis they knew was impacting young men early in 2021, instead of issuing an alert on the Health Alert Network, they developed 17 pages of talking points. This was given to the public under a FOIA request. They had to go to court. They've got a new way of redacting. They don't black things out. They just give you white pages. So you don't even know what they have redacted.
خیلی نکته جالبی داره میگه اینجا جانسون.
So again, I've issued a
میگه
subpoena
وقتی من
now.
از دولت بایدن در مورد مسائل مختلف مثل کووید سوال میکنم به من دیتا میدن ولی میان بخشای زیادی از سفر رو روش خط میکشن رو جملات مختلف و تو نمیدونی اینا چیه و همیشه میگن به خاطر دلایل امنیتی و محرمانه نمیتونیم خیلی اطلاعات رو بدیم و الان به جای رسیدن که دیگه برگه سفید میدن، نمیخوان اطلاعات شفاف بدن به افراد که داره چه اتفاقی تو حوزه سلامت میفته. بحث اطلاعات بحث خیلی مهمیه واقعا. من هنوز دارم به این فکر میکنم که ما چطور نمیدونیم دقیقاً کووید از کجا اومده، چطور گسترش پیدا کرده. با وجود این همه اطلاعاتی که تو جاهای مختلف جهان ثبت شده، هنوز نمیتونیم شفاف بدونیم واقعا چی شده. بعد حدس بزنیم. و این واقعا فاجعه است به نظرم. این یه فاجعه است که آدمی مثل کندی فقط میتونه بپردازه به خاطر دلایل مختلف شخصی و حرفه‌ای.
Issue that should unite us more than this chronic health epidemic. There's no such thing as Republican children or Democratic children. These are our kids. 66% of them are damaged. I know what a healthy kid looks like because I had so many of them in my family. I didn't know anybody with a food allergy growing up, peanut allergy.
وقتی بزرگ شدن ندیدم هیچ بچه‌ای آلرژی بادام زمینی داشته باشه. قبلا اینطوری نبود، الان هست. چی شده؟ سوالش اینه.
Depression, all these things that are related to toxics in the environment. Why can't we just agree with each other to put differences about so many issues, intractable issues aside, and say, we're going to end this? I don't think anybody is going to be able to do this like I have. Because of my peculiar experience, because I've litigated against these agencies. When you litigate against them, you get a PhD in corporate capture and how to unravel it. I've written 6 books about these agencies.
کندی میگه دلیلی که من بهترین فردم اینه که من بارها از این سازمان‌های فدرال شکایت کردم چون شفاف نیستن.
Because I'm not scared of vested interest. I don't care.
چون من کتاب نوشتم تو این حوزه، چون من نمیترسم، چون منافعی ندارم تو این موضوع.
This is something I don't need. I want to do this because we're going to fix it. And the other thing is we are attracting now a caliber of people to HHS like never before in history. And they're entrepreneurs, they're disruptors, they're innovators of immense talent that are walking away, many of them from growing concerns. They're not coming there or position. They're coming there because they want to save our country. And they're from across the political spectrum. And all these Democrats are opposed to me for partisan issues. They used to be my friends. Agreed with me on all the environmental issues.
دوستای من بودن یه زمانی.
Now they're against me because anything that President Trump does, any decision he makes, has to be lampooned, derided, discredited, marginalized, vilified.
We need to move on. Senator Warren.
Thank you, Mr. Chairman. So, Mr. Kennedy, I want to start with something that I think you and I agree on. And that is that Big Pharma has too much power in Washington. You've said that President Trump asked you to, quote, clean up corruption and conflicts.
میگه تو گفتی ترامپ گفته که فساد از بین ببر.
You will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an easy question.
میگه ارتباط بین شرکت‌های داروسازی و سازمان‌های فدرال می‌خوای از بین ببری که خیلی خوبه.
A medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member.
Can you just repeat the last part of the question? Can I commit to
You're not going to take money from drug companies in any way, shape, or form.
میگه تعهد میدی که از شرکت‌های داروسازی پول نگیری. میگه آره.
Yeah, I'm happy to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with.
میگه من تعهد میدم پول نگیرم.
خندش به خاطر اینکه want to give me money, by the way.
Let's keep going. You're right because
خندش به خاطر اینکه کندی دشمن شرکت‌های داروسازیه و وارن میگه قول میدی پول نگیری. میگه معلومه.
As our number one health officer is to help them and not to make money for yourself in the future. So I want to talk more about money. I'm looking at your paperwork right now. In the past 2 years, you've raked in $2.5 million from a law firm called Wisner Baum. You go online, you do commercials to encourage people to sign up with Wisner Baum to join lawsuits against vaccine makers. And for everyone who signs up, you personally get paid.
دو سال گذشته 2 میلیون دلار از این شرکت حقوقی گرفته که با واکسن مبارزه میکنن، با شرکت‌های واکسن سازی.
Gets $10 million, you walk away with $1 million. Now, you just said that you want the American people to know you can't be bought, your decisions won't depend on how much money you could make in the future. You won't go to work for a drug company after you leave HHS.
دیگه تو گفتی حاضر نیستی پول بگیری از شرکت داروسازی، نمیری بعد براشون کار بکنی.
Mr. Kennedy, will you also agree that you won't take any compensation from any lawsuits against drug companies while you are secretary and for 4
علیه
years
شرکت‌های داروسازیش پولی نگیری وقتی وزیری و چند سال بعدش؟
To that while I'm secretary. But I do want to clarify something because you're making me sound like a shill. I put together that case. I did the Science Day presentation to the judge on that case to get it into court.
Mr. Kennedy, Mr. Kennedy, it's just a really simple question. You've taken in $2.5 million. I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your
میگه تعهد میدی که
out of
از
that
شرکت‌های
while
داروسازی
you're
شکایت
secretary and
نکنی
for
و از
4
این راه
years
پولی در
after.
نیاری.
I'll commit to not taking any fees from drug companies while I'm secretary.
I'm asking about fees from suing drug companies. Will you agree not to do that?
You're asking me to not sue drug companies,
No,
and I'm not going to agree to that,
drug
Senator.
companies as much as you want.
خیلی خوب. میگه تو میخوای منو مجبور کنی از شرکت‌های داروسازی شکایت نکنم و من این کارو میکنم. من شرکت‌های داروسازی شکایت میکنم. سالها این کارو کرده.
Secretary of HHS, if you get confirmed, you could influence every one of those lawsuits. Well, let me start the list. You could publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by. You could appoint people to the CDC vaccine panel who share your anti-vax views and let them do your dirty work. You could tell the CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up manufacturers to mass torts. You could make more injuries eligible for compensation even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits. You could turn over FDA data to your friends at the law firm, and they could use it however it benefited them. You could change vaccine labeling. You could change vaccine information rules. You could change which claims are compensated in the vaccine injury compensation program. There's a lot of ways that you can influence those future lawsuits and pending lawsuits while you are secretary of HHS, and I'm asking you to commit right now that you will not take a power to undercut vaccines and vaccine manufacturing across our country. And for all of his talk about follow the science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about then say you won't make money off what you do as Secretary of HHS?
Before we go to Senator Tillis, I think it would be important for me to make it very clear that Mr. Kennedy has gone through the same Office of Government Ethics process as every single other nominee in the Finance Committee this year and in previous administrations. In addition to listing his assets, including the items that you've identified, he has signed an ethics letter that has been reviewed by the Office of Government Ethics concerning any possible conflict
و شکایت خواهم کرد در آینده. تعهد نمیدم که شکایت نکنم. و کریپو داره توضیح میده که کندی از نظر رویه‌های اخلاقی مقامات فدرال همون رویه‌هایی رو طی کرده، همون رویه‌هایی رو طی کرده که بقیه مقامات طی کردن.
Who's made $2.5 million off suing one of the entities that it would be regulating and plans to keep getting a take of every lawsuit in the future? Have we had that before?
I haven't reviewed the past documentation of every other nominee's financial interests, and so no. But I know that every single time we get a nominee, their financial interests are attacked. That's why we have the Office of Government Ethics. That's why they've reviewed everything that's in his record, and that's why he has even, I think, and I don't know that I want to ask him to get into it, but he has listed his assets and has gone through a discussion of the responsibilities under our ethics laws and has complied with all of those requirements.
اگه قرار درآمدی کسب بکنه همون رویه ها طی میشه دیگه.
Thank you, Mr. Chairman. Mr. Kennedy, how's your morning going?
So far, so good.
Good. You came prepared. I'm glad that you did. You, I believe, addressed to my satisfaction a question about Title 10 and the President's priority with respect to Planned Parenthood. Can you just affirm that you are 100%
الیزابت وارن جزو
behind the
دموکرات‌های
policy of
خیلی
Title 10?
رادیکال در بعضی مسائل.
Thank you.
اولش به نظرم شروع خوبی داشت، ولی خب سر بحث شکایت کردن شرکت داروسازی خیلی منطقیه که این به عنوان شهروند حق داره از شرکت‌های داروسازی بعداً شکایت بکنه بعد از این کارش تمام میشه. من اینو خیلی شنیده بودم که میگفتن در طول دوره وزارت نباید با شرکت‌های داروسازی، شرکت‌های اون صنعت، اون حوزه در ارتباط باشی، ولی اینکه از شرکت‌ها شکایت نکنی و از راه شکایت پول در نیاری یه مقدار جدید بود واقعا. خب تریس میپرس آیا تو حامی توهم توطئه، تئوری توطئه هستی؟
I was told that I was a conspiracy theorist. That label was applied to me because I said that the vaccines, the COVID vaccine, didn't prevent transmission and it wouldn't prevent infection.
یه من اولین بار یه زمان به من گفتن به خاطر اینکه گفتم واکسن کووید جلوی انتقال کووید رو نمیگیره.
I was called a conspiracy. Now everybody admits it.
میگه حالا همه به این رسیدن، حالا همه اعتراف میکنن که واکسن کووید جلوی انتقال نمیگیره.
And now FDA has acknowledged that and banned it. I was called a conspiracy theorist because I said fluoride lowered IQ. Last week, JAMA published a meta-review of 87 studies saying that there's a direct inverse correlation between IQ loss.
All right, so I'm going to assume
I could go on for about a week.
So is there any one of them that you can say, you got me, that really was a conspiracy theory, or are you in a position to submit for the record? I think it'd just be helpful for every one of these narratives.
توی آب شهرهای آمریکایی و آیکیو بچه‌ها رابطه وجود داره. یک هفته پیش یه مقاله منتشر شد که نشون میده واقعا ارتباط وجود داره. هر چیزی میگفتن توهم توطئه بوده بعدا معلوم شد درست بوده. خیلی جالبه، تو خیلی حوزه‌ها اینطوری بوده.
And what we have now are kids that are not eating the food because the dictates of the federal government have made it something that they don't want. But they say, well, it's a healthy alternative. It has processed materials in it, and it's not particularly attractive to them. So they throw it away. Trash cans full of food that these kids didn't eat. So then what do? They go eat snacks, or they go eat or they drink a sugar drink. The SNAP program, everything you've said about the SNAP program, I agree with. I think that we should be very, very strict about that, and it's going to make some people uncomfortable in the food manufacturing segment, produce healthy foods that we can put in the SNAP program. That's the way to address it. But we also need to look at the school health program. I was PTA president 21, 22 years ago at my daughter's high school.
داره در مورد برنامه‌های غذایی توی مدارس آمریکا صحبت میکنه که دولت فدرال این برنامه غذایی رو حمایت مالی میکنه و اینکه غذایی که داریم بچه‌های آمریکایی میدیم از طریق کمک‌های فدرال چقدر ناسالمه.
Nobody's admitted that Medicaid is not producing positive health outcomes. Is that your problem in Medicaid right now, the program or the outcomes?
is the outcomes. We're spending $900 billion, and our people are getting sicker every single year.
Yeah, so
And
anybody who's
President Trump
building
wants people to have it, Americans to have high-quality insurance. That's what
anybody
he's-
who's building a case for the status quo of Medicaid is by extension saying that they're happy with the outcomes. I think it's unacceptable. I do have a question for you on Project Warp Speed. We supported the CARES Act. We had 97 people in the U.S. Senate vote for it. Everybody here. There was only one member of Congress that voted against it, I believe. And Project Warp Speed had CDC, FDA, NIH, and BARDA very much in the mix. Now, some people think that you're going to come in here and insert yourself into those agencies in a way that's never been done before. Let's say that they're a part of a future Project Warp Speed. Is it your intent to go in and do something that's never been done before based on my staff's research and insert yourself in a discussion that the scientists are dealing with in those different agencies?
No, Senator. What I want to do is, I'm not a scientist. I want to empower scientists. I want to make sure that science is unobstructed by vested or economic interests.
That's good.
یه نفر تو کامنت میگه برنی سندرز هم کنار وارن نشسته.
It was an extraordinary accomplishment.
برنی سندرز هم تو این کمیته هست. منتظرم سوالای سندرز رو بشنویم.
When he promoted Operation Warp Speed, he was looking at all of the different remedies, including vaccines.
Therapeutics, everything.
Therapeutic, ivermectin, hydroxychloroquine, famotidine, even chlorine dioxide. And he was not looking at shutting down our country for the year, forcing people to wear masks for a year, forcing all social distancing that did not have any scientific basis, which Dr. Fauci has now acknowledged. He said, we took it out of thin air. But all of those changed during the Biden administration. And it became very narrowly focused. We ended up with the worst, the highest death count of any country in the world.
Mr. Chair, if I can just ask one final question, and I think it's a one-word answer. I've heard a lot of people complaining about health care delivery, Medicaid. On the other side of the dais here, who's been responsible for health care policies over the last 4 years?
The Biden administration.
I mean, the president, the Biden, okay. Yeah. So that I'd like to have heard more of those in oversight hearings over the last 4 years. I haven't, but I'm glad that there's an acknowledgement that you're inheriting a problem that needs to be fixed.
خیلی دوست دارم بشنوم که دموکرات‌ها در مورد این موضوع چی میگن که بایدن چیکار. خب برنی سندرز اومد. سناتور سوسیالیست ورمانت.
Like the slogan that you coined, Make America Healthy Again. And I strongly agree with that effort.
چه شروعی میگه من خیلی موافقم با Make America Healthy
Again. As you
Again.
indicated, 2 or 3 times as much per capita on healthcare as other nations. We have 85 million people who are uninsured, underinsured. We have
بیش از هر کشوری هزینه می‌کنیم برای درمان. میلیون نفر داریم که بیمه نشدن.
And for working class people in this country, they are living 6-7 years shorter lives than the top 1%. We got a problem.
امید به زندگیمون پایینه.
Suggest some ideas that I think can remedy that.
Last
year, the insurance industry in this country made over $70 billion, while at the same time 85 million Americans are uninsured or underinsured. Do you agree with me that the United States join every other major country on earth and guarantee health care to all people as a human right?
Yes? No. هلسکر خدمات درمانی به عنوان حق انسانی به همه شهروندان داده بشه.
Healthcare a human right. Is healthcare a human right?
میگه حق درمان یک حق انسانی هست یا نه؟ منظورش اینه که حکومت بده هزینه‌اش.
I would say it's different because if with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now
میگه تفاوتش اینه که اگه 30 سال سیگار بکشی
are you guaranteed the same right or is there also a duty
30 سال سیگار بکشی هزینه درمان تو باید بقیه بدن اگه قرار باشه درمان حق انسانی باشه تفاوتش با حقوق دیگه مثل حق بیانه
younger role to human right. I'm not hearing you say that. All right, you've talked about the drug companies and maybe we agree on this one. As you all know, despite the drug companies making over 100 billion in profits, paying CEOs outrageous
موافقم که شرکت‌های دارویی دارن درآمد خیلی
packages.
زیادی
We,
به
in some
دست میارن.
cases, pay 10 times more for the same drug. Will you support legislation that I will introduce which says that in America we should not be paying a nickel more for prescription drugs than people around the rest of the world? Yes, no.
میگه حمایت میکنی از مصوبه‌ای که بگه این آمریکایی‌ها نباید هزینه بیشتری بدن برای دارو نسبت به کشورهای دیگه.
It has asked me, in fact, I had a meeting with President Trump a week ago where we showed him the charts.
He knows the charts.
We're paying 10 times more from Europe.
That's right. And are you going to commit to us that you will end that absurdity?
I think in principle we can. We should end that disparity.
Good. Okay. That's great. All right. I happen to believe that climate change is real, it's an existential threat, and it is a healthcare issue.
اقلیمی واقعی به مسئله
سلامت. Donald Trump thinks that it is a hoax originating in China. Question is, in your judgment, is climate change a hoax or is it real, causing devastating problems?
President Trump and I, from the beginning, from our first meeting, agreed to disagree on that issue. I believe climate change is existential. My job is to make Americans healthy again.
All right, you believe that you disagree with Trump, you don't think climate change is a hoax, is what I'm hearing.
My job here is to make
Americans healthy. I'll just ask you that, Mr. Kennedy, not a trick question.
I answered your question, Senator Sanders.
Okay, you disagree with the president on that.
من موافقم که تغییرات اقلیمی واقعیه.
I'm going to pick up on a point.
میگه با ترامپ توافق داریم که با هم موافق نباشیم.
There is no question that abortion is a divisive issue in this country. I would say a majority of the people are pro-choice. There's a strong minority.
میگه اکثر آمریکایی‌ها حامی انتخاب.
A year and a half ago, you went to New Hampshire.
حامی زندگی تو سخت جنی.
Running for president, gave a speech, and you talked about government should not tell a woman what she can do with her own body.
میگه تو سخنرانی گفتی حکومت نباید به زنها بگه چیکار کنن تو بحث سخت جنی.
I think everybody on that side is pro-life. I think everybody here is pro-choice. I have never seen any major politician flip on that issue quite as quickly as you did.
میگه تو خیلی نگرش تغییر دادی یا پرو چویس باشه پرو لایف.
HHS secretary. Tell me why you think people should have confidence in your consistency and in your work when you really made a major U-turn on an issue of that importance in such a short time.
در مورد یه چیزی مثل سخت جنین اینا تغییر کرده.
I believe and I've always believed that every abortion is a tragedy.
But you told the people in New Hampshire that it was their right.
این جمله رو این بنده خدا 3 بار گفت نذاشتن توضیح بده. چرا سخت جنین تراژدی؟
I think the gist of what you're trying to say today is you're really pro-vaccine, you want to ask questions. You have started a group called the Children's Health Defense.
یه گروهی درست کرده دفاع از سلامت کودکان.
Right now, as I understand it, on their website, they are selling what's called onesies. These are little things, clothing for babies. One of them is titled Unfaxed, Unafraid. Next one in the sold for $26 a
وبسایت این سازمانی که تو درست کردی یه همچین تیشرتی فروخته میشه ظاهراً.
Now you're coming before this
No
committee
vax, no problem.
and you say
نزدم
you're
مشکلی هم
pro-vaccine.
ندارم.
Just want to ask some questions. And yet your organization is making money selling a child's
میگه تو میگی حامی واکسنی اما شرکت اما سازمانی که راه انداختی داره پول در میاره از مخالفت با واکسن.
Can you tell us now that you will, now that you are pro-vaccine, that you're going to have your organization take these products off the market?
Senator, I have no power over that organization. I'm not part of it. I resigned from the board.
That was just a few months ago. You founded that. You
من
certainly
چند ماه
have
پیش
power.
این سازمان استعفا دادم کناره‌گیری کردم.
Supportive of this?
I've had nothing to do with
Are you
leadership.
supportive of these onesies?
I'm supportive of vaccines.
Are you supportive of this clothing, which is militantly anti-vaccine?
I am supportive of vaccines.
من حامی واکسنم. هیچ ارتباطی هم با این لباس‌ها و این سایت ندارم.
But you will not tell the organization you founded not to continue selling that product. Thank you, Mr. Chairman.
Senator
خندش
Blackman.
گرفته کندی.
Thank you so much, Mr. Chairman, and thank you so much
خب
for being with us
2 ساعت و
today.
نیم
And I have no
جلسه رو دنبال
doubt that you
کردیم.
will be
فکر
confirmed
می‌کنم
and you
تا حد
are
خیلی
going
زیادی
to do
پوشش دادیم
such a
بحث‌های
solid
اصلی
job
که
for
مطرح
the
شد.
people of this country.
2-3 نفر دیگه فکر کنم موندن که سوال مطرح بکنن، اما اگه موافق باشین برنامه رو به پایان برسونیم. لایو خیلی طولانی بود و اگه بخوام یه جنبندی داشته باشم به نظرم میاد که کندی نگرش خودش رو خوب مطرح کرد و اون تصویری که میخواستن ازش ایجاد کنن به عنوان یک فردی که تئوری های توطئه رو مطرح میکنه، ایده های رادیکال عجیب غریب داره، واقعا ما اینو ندیدیم ازش. گفت من از واکسن حمایت میکنم، طرفدار شفاف سازی هم، اطلاعات بدیم در مورد سقط جنین. معتقدم که باید ایالت ها تصمیم بگیرن، دیدگاهی که ترامپ هم داره. در مورد خیلی موضوعات سیستم درمانی هم گفت اطلاعاتی ندارم و حاضرم ازتون مشورت بگیرم برای اینکه تغییر ایجاد بکنیم. یه سوالی مطرح شده، من این جواب بدم و لایومون رو به پایان برسونیم. اگه سوال یا نکته‌ای دارین در مورد کندی و برنامه که تا الان دیدیم، خوشحال میشم بنویسین توی چت در مورد صحبت کنیم. سوال اینه که اگه سندرز میتونست تو انتخابات ریاست جمهوری شرکت کنه به احتمال بالا رأی می آورد. چقدر این حرف درسته؟ چقدر بین اقشار مختلف آمریکا طرفدار داره؟ سوال خیلی جالبی. یک زمانی سندرز شانس خوبی داشت برای این موضوع توی انتخابات 2016 که با کلینتون رقابت داشت. نسبتاً کمپین خوبی شروع کرده بود برنی سندرز و ما بعدها دیدیم یه سری از آدم‌هایی که حامی ترامپ شدن، یه سری از حامیای ترامپ گفتن ما حامی برنی سندرز بودیم توی 2016 و بعد که دموکرات‌ها سندرز رو کنار گذاشتن تصمیم گرفتیم به ترامپ رای بدیم. به نظر میاد که نگرش سندرز یک زمانی توی آمریکا طرفداری خیلی بیشتری داشت، ولی واقعیت این یه سری از دیدگاه‌هایی که سندرز داره به واسطه اینکه واقعا دیدگاه‌های خیلی رادیکال فراتر از دیگه لیبرالیسم آمریکایی میره به سمت سوسیالیسم، خیلی بعیده که بتونه یک همچین نگرش توی آمریکا رای بیاره. تاریخ آمریکا نشون داده که سوسیالیست‌ها شانس چندانی ندارن برای اینکه توی آمریکا بتونن به قدرت برسن. جلسه ادامه داره ولی ما برنامه رو پایان میرسونیم. متشکرم که با من همراه بودین. جلسه کمیته مالی سنا رو دیدیم برای بررسی صلاحیت رابرت کندی جونیور. فردا هم جلسات مهمی در پیش داریم. جلسه دوم کندی فردا صبح برگزار میشه، همین تایم به وقت ایران. جلسه بررسی صلاحیت کش پاتل فردا برگزار میشه که خیلی جلسه مهم و جنجالی خواهد بود. قطعا کش پاتل قرار رئیس FBI بشه. جلسه بررسی صلاحیت تورسی گبرت فردا برگزار میشه که قرار رئیس DNI بشه، سازمان اطلاعات آمریکا، که اون هم جلسه خیلی مهمیه و میتونه نکات خیلی جالبی داشته باشه. متشکرم که با من همراه بودین. اگر این برنامه براتون جذاب بود ممنون میشم لایک کنید. اگر براتون امکان داره دونیت کنید از طریق یوتیوب یا پلتفرمایی که معرفی کردیم. من سعی می‌کنم لینکش هم بذارم توی دسکریپشن براتون. به شدت قدردان کمک‌های شما هستیم و از همه مهمتر این که ما رو معرفی کنید با آدمایی که به نظرتون میتونن علاقه‌مند باشن به بحث تاریخ و سیاست آمریکا. شبتون بخیر. خدا نگهدار.